that took place. So some insights we heard included personnel challenges, organizations having a hard time making sure they have enough staffing, ideas on how to create a software library for the state to be able to pull together and collaborate with different software options, how to better address logistic challenges with the consumer in mind, coordination between health and transportation systems, which I thought was very interesting, especially in rural communities. We heard from rural Arizonans yesterday that they would like better cooperation in that area. And maybe a coalition on transportation to bring together statewide voices that is of interest. There were also comments about a statewide overview of the various plans, purpose, and goals that's easy to understand. So how do we put those plans into language that everybody can understand? How do we continue to outreach and educate on resources already in place for programs that are available? And how do we remember that the one need of a person can lead to a melting pot of services and require multiple resources? So with that in mind, I did want to also cover a few bits of housekeeping this morning before we kick off. If you are going to speak and you're in the room, if you could please be sure to turn your microphone on so the folks online could be sure to hear you. And if you're online, we encourage you to use the chat function. We will be happy to read your comments as the day goes on. If you haven't already found that we do have some food left over from last night's reception, please help yourselves whenever you'd like to. There's also coffee and water in the break room. And if you need to use a restroom, we have the women's restroom down this hallway and the men's restroom down this hallway. I think those are all of my housekeeping points. I did want to also just, when we're talking about thinking about the consumer, one of the things that I thought was really fabulous about yesterday were the variety of voices around the table. We had folks representing a wide variety of stakeholder groups, including older adults, adults experiencing homelessness, individuals with physical and intellectual disabilities, and others who are looking for new transportation options across the region and the state. I mentioned yesterday that part of the reason that I'm personally interested in this work is because of my friendship with my colleague, Diane. Diane came back today, Diane Wassley, and she is a Special Olympics athlete. I actually met Diane through the Arizona Public Health Association because she just graduated with her degree in public health from NAU. So I thought we would ask Diane to come up this morning and just share a little bit about her experiences with transportation across the region and things that she would like to see in the future as today's conversation. So if you please help me in welcoming Diane. So Diane, how did you get here today?
Oh, I did take the light rail this morning. Sorry, my apartment's on the light rail.
And what were some of the challenges in maybe just talk about this morning? What were some of the challenges in getting on the light rail and getting here?
Oh, I have to think about how much time it's gonna take, and we're getting everything ready, and then I missed the train and wait like another 15 minutes. And then I got here and I was like, not sure where the crosswalk is because it's like all the construction they have over there. And the crosswalks are kind of a challenge. Sometimes they'll take forever to turn to walk. So then I'll miss the rail because I can't get across the crosswalk.
Okay. All right. Is there anything else you'd like everyone in the room to know about public transit?
It is really a challenge because it takes so much time and planning, and I do have a big problem with the paratransit system. Even I have argued before, even went to court before, because when I was in school, I said I was always late to school because I cannot get to school or a job on paratransit. So that was my biggest concern, that they're not capable of getting me anywhere on time. So I managed to take Lyft, and I managed to find a way to get covered to take Lyft and Uber to my internship. But now I guess that I graduated, it's like gonna be what's next, because it's gonna create so much stress just to think about getting the job on time. So
thank you, Diane.
Thank
you very much. One of the insights that Diane shared with us yesterday that I thought was so useful and important is she mentioned she lives right here off of the light rail line in downtown Phoenix, but her family is in Chandler and she has a sister who's been hospitalized that she likes to be able to go visit. But to travel from Phoenix to Chandler requires her using 2 different cities' public transit, and it costs different things in each of those cities. And that can be a challenge as well. And so one of the solutions that we brainstormed in one of the breakout sessions yesterday was the possibility of a universal pass for certain individuals who need to cross across city lines through public transit. So just another possible solution coming out of the first 2 days of this conference. So again, I just want to welcome you and thank you for being here. And with that, I'd like to invite my colleague, I believe my colleague Anjali, up to kick us off for the next series of speakers. Thank you again.
Thank you. Good morning, everyone. We're going to kick off this morning with National Coordination Best Practices, and Al Benedict, which is the Director, Learning Center of SUMC, Shared Use Mobility Center, and I have partnered representing the National Center for Mobility Management on that team. And we are going to talk about best practices in regards to universal mobility, which affects everyone. So whether it's sidewalks, bus stops, highways, just your arterial roads, center designs or station designs, it's all encompassing. So Al is going to kick that off first on the first half of the presentation. This is a very lengthy learning module that you can go to both the TA Center sites and you can search and go over it with your teams and your organizations. Or if you have another convening of this sort, you all can go through. There's a checklist that can be used as well. And so we'll have that information that Kelly and Amy can share with you all further. So we're just going to give you a snippet instead of, we don't have time for an all-day session on this. So I'll let Al start and he should pop up on the screen here in just a little bit.
Thanks, Anjali. She's right. It is. We're just going to touch on pieces of it because it is. This was. It's lengthy, but there's a lot of. We think a lot of really good information in it. So my name is Al Benedict. I'm with the Shared Use Mobility Center, and I'm going to talk to you about the universal mobility learning module that we worked on with NCMM. So SUMC, just real quick, we're a nonprofit organization. We're based out of Chicago. We have offices in California and satellite people working remotely throughout the country. But we really strive to promote an equitable and sustainable transportation system that serves all users equally, regardless of need or economic circumstances. And we see, the diagram to the right, we see public transit as really the center of that. And then, shared mobility, of course, there's all these other modes that are there and technology to help support public transit and that, creating a diverse and accessible multimodal system. Next slide, please. Or can I guess I can't advance, right? There we go. So I won't talk about all our work. I just wanted to touch on just this piece right here. We're FTA Technical Assistance Center, along with NCMM. And this, we recently provided technical assistance to the mobility innovation pilots. And the map here shows where they are across the country. It's a great learning experience, learning with these mobility pilots as they alongside of them as they're working on implementing innovative mobility solutions, from payment integration to microtransit to serving unique populations within a city. And so really interesting stuff. And we draw with the module today in our work across the organization. We really draw from those experiences. Next slide, please. So I want to, before we kick in, just want to announce our upcoming annual Share Mobility Summit. It's our 10th year. It's a great event. It draws in hundreds of people from across the country, from policy to agencies to community groups, really working together to look at and understand innovative mobility solutions and what they can do to promote a sustainable and equitable transportation system. So this year, it's in Chicago every year, but this year it's in May 2024. Encourage everyone, if you can, check it out. And if you have any questions about it, there's information on our website. And you know, I'm happy to, if you have questions, you can send me an email to my emails at the end of this presentation. Next slide. So I'll kick right into the universal mobility resource that we worked on. And this, you know, again, actually, you can go to the next slide too. So this was really, you know, it was a partnership with NCMM, and we convened a diverse working group, kind of leaders in this space, cutting across different elements around creating accessibility and universal design. And we really drew from these targeted discussions that we had with the working group to understand the barriers and solutions to implementing a universal mobility system. And this right here it's available on the Mobility Learning Center. And Julie touched on that. There's a URL, and I'm sure she'll share it with others. But this is just the splash page for it when you enter in, and then it kind of digs into these different modules that we're talking about within here. Next slide, please. So what is universal mobility, though? So universal mobility is really the design practice that ensures all transportation products and services are inclusively designed and available for all user groups. And so it really combines these two terms, brings universal design and inclusive mobility together. Universal design really focuses on the composition and the environment to assure that it is accessible. Whereas inclusive mobility really views mobility as a human right, that all people, regardless of age, size, disability, or ability, have a right to move throughout their community. And so bringing those two terms together, we then explored what other elements fit into, you know, creating the universal mobility system. And those are understanding passengers, service planning and coordination, and the mobility data and technology. And today I'm going to be talking about universal design and mobility data, and Anjali is going to be talking about understanding passengers and service planning and coordination. Next slide, please. So this right here, the work universal mobility really centers around the complete trip, the concept of the complete trip. And this is from the Accessible Transportation Technologies Research Initiative. And it's really technology driven. And what we're talking about goes beyond that. But I thought this did a really good job of just kind of outlining the flow and the process and what a complete trip really means. And as we're going to talk about, there's more, but this from a technology perspective, in this case, this is from the ATRI website. Andy wants to go to the coffee shop, and so he's able to use his phone to find out what transportation options are available, and then also book that trip. And he's able to. Some of these are more aspirational than others. There's a robot walking Andy to the bus, and you know there's travel to the transit station, and then assistance from the station to the actual vehicle. You know, there's what kind of technology in this case could benefit that. And then of course the ride, he's able to use his phone to understand where he is and call for the stop. And then crossing the street, there's technology signaling at the lights, and of course curb cuts and whatnot too, I'm sure are in place. And then arriving at the destination. And so again, this is really focused on that technology piece. And what we're digging in today is kind of extends beyond that. But I wanted to kind of just call out the complete trip and really what we're thinking about. Next slide, please. So here is the universal mobility planning and implementation. We're back on the website. These are the different elements that are there. Each of the elements has a summary kind of outlining the issue and need. And then there's challenges that an agency or a mobility provider might encounter when implementing these solutions. And then we also have recommendations and then resources. And Anjali touched on this. There's a checklist for each of these elements and steps agencies can take to really understand what's involved in implementing some of these solutions. And the checklist, it's long, and I think it's sort of thinking about this not all at once, but building on each other, and kind of setting out a vision. But really, it stems from changing the culture within an agency so that accessibility is front and center. It's no longer an afterthought, and that's really all these ideas that we're talking about really stem from that concept, and just thinking of this as a way of operations. Next slide. And so I'm going to dig into universal mobility. There's 3 components to that: facilities, operations, and then information systems. Everyone kind of understands, I'm sure, the physical features of a bus stop or a station. Are they accessible? Can people navigate throughout a station? Can they, is there wayfinding? Is there an elevator? There's all those physical characteristics that we're all, I'm sure, really familiar with. But then that extends beyond to the actual neighborhood infrastructure. So are the pathways to that bus stop, are those accessible? And if not, then that bus stop really, that isn't accessible, if somebody can't access it. So really thinking about universal design and, as in its total, not just the station or the bus stop, but access to there, and can people make that connection? Next slide. So the next piece of the universal design is operations. How individuals really learn about services, schedules, costs, purchasing tickets and paying fares. All these are important to really completing that trip. If any link of those is broken, then the trip really isn't accessible either. For example, learning about services. There might be a lot of mobility options available in a community, but if nobody knows about them, then that's how can we think about making sure people are aware of what kind of services are available, and then how to then use those services. Those are all really important operational considerations. And let's see, next slide. So the next piece is information systems. Kind of, and this includes, how can people with sensory disabilities or cognitive disabilities understand the transit network or vehicle, or the mode they want to take. And so that can wayfinding, just signage is critical. Is that easily understood? Is it visible? But then there's also kind of new things on the horizon that it's exciting to see. The gentleman here in the photo is visually impaired, and he's using an app to navigate where to stand at the bus shelter. And the app will also give him information on when the next bus is coming. And so, there's the kind of innovative technology stuff, but it really starts with really just core basic infrastructure and making sure that this information about the mobility services is available and easily understood. Next slide. So information systems. So this right here, it's really important to engage the community, the disability community, when planning services, when operating services, really throughout the process. They use the service, they understand, does it meet their needs? And really opening up that dialogue to really work with and develop services that really meet their needs, meet the needs of the community. So that's one form of the information systems. The other form is within an agency itself. Are the different departments in a transit agency, are they siloed? Is the planning staff get to talk to the drivers? Is there a way for the drivers to communicate what they're learning on the ground to the planning staff to really understand the systems? Drivers working with the riders on a daily basis really have a pulse on what's working and what isn't, and really opening up that dialogue is critical. Next slide, please. So I'm going to jump into, we want to save a lot of time for questions, so kind of going through this quick. If there, we'll save questions till the end. But so mobility data and technology is the other element that I'm just going to touch on. Next slide, please. So I think we're all, it's really having an understanding how mobility services operate in real time and making sure that information is available to the public. I think GTFS is, most people are a good number of people are familiar with it now, given the new FTA NTD reporting requirements that it will be required NTD field. And general transit feed specification is a discovery data point for transit services, bus, rail, other. And I guess if anybody uses Google Maps, for example, or Apple Maps, that's, and they use the transit function, that's GTFS at work. And it's when it's all, and the reason they're able to communicate that data across different platforms is that common data language, and that language is GTFS. And so there's other, that's kind of the starting point, but there's other sort of innovative projects that are also happening that are really sort of trying to build on that GTFS, that open data solution. For example, the diagram on the right is the MnDOT. This was an FTA project that we worked with. MnDOT had developed and it's launched Mobility as a Service app. And that app includes GTFS feeds so people can discover where services are, but it also includes the ability for booking services, different modes. And so it's really sort of building on that much more. And that communication is happening, and they're able to build that platform because of those open data solutions. So really, those are, nobody, you don't really jump into sort of a MOS platform, but you really kind of can try to understand what's available and kind of building the management systems in place so that you're ready for when that happens, or you can take pieces of it into your community based on what your needs are. Next slide. So new technologies, I just have a few more slides. New technologies and mobility data driven solutions, they're continually emerging. It's really important to engage with the community throughout in particular persons with disabilities throughout that process to understand and design tools and resources that meet their needs and services themselves. I was involved in a project, and we were meeting with, this was elderly Koreans, and we were really interested in working with them to start microtransit service. And we learned that they didn't really want microtransit service, and so what kind of services best met their needs, and we worked with them to help design that system. But opening up that dialogue is really important. Community and Anjali, won't go into too much more detail because she's going to talk about that. But community organizations are a critical piece to that. Next slide. And this right here, so data management systems, just really thinking through your staff capacity, knowledge. Are there other sort of resources, regional, state DOTs, for example, that might be able to assist in that? But really trying to start small and develop that capacity, but then thinking how it can evolve over time. And these things do provide, you can put that foundation work in place early on, and it's designing tools that meet the needs of the community. Some of the early one call, one click platforms were developed in silos, both not involving the community necessarily, and cross agencies across the region. And a lot of those are no longer functioning or available because they didn't really invest early on, and they've either had to redesign or rebuild them, and that's often can be more costly than kind of doing it right the first time. 2 more slides, and then I'll turn it over to you, Anjali. Hope I didn't take too much time. One more. So I'll just touch on these. Next slide. So there's a lot of federal policies out there. I'm just going to show a couple of them, but this just to, and I encourage you to explore what funding streams might be available for your community need. This is an accessibility program by the FTA to make sure transit stations are accessible. Next slide. And then this right here, this just reiterates that the pathways of travel are important, and the U.S. Access Board says so, given the final rules that they put out, that the public right of way and accessibility guidelines. Just another resource to dig into this and see how it might apply to your community. With that, I think that's my last slide. My contact information is on the next one. And I will turn it over to you, Anjali, and thanks. And I wish I could be there in person. And sounds like a great workshop.
Thank you, Al. Can I use this time? Will this work? Okay. Nope, it's not working. Okay. Well, there it goes. Okay, now it's working. I think it was just trying to catch up. All right, so I'm going to discuss understanding passengers. And as I move around a lot when I speak, some of you guys know that, and it's gonna be kind of interactive. By a show of hands, how many of you all think that you understand your constituents that you represent? Or understand your customer? That could be a passenger of public transportation. Just a few of you all. Don't be scared. It's not absolutely okay. Not fully okay. So understanding the passenger, what does it involve? Diverse social service and community-based organizations, just like we have in the room, everyone needs to work together, right? To making sure that we have accessible and sustainable services, and also the facilities and the infrastructure that leads to those services. Engaging the community, okay? I'm glad that Diane was able to get up and speak today, because you all kind of got to visualize and walk through her shoes to see what she went through today just to get here, okay? And so she lives on a light rail line. But what if I don't live on light rail line? What if I live way out in like city of Glendale? And well, right. And I had to get here, right? So just think how much further, and how I would have to plan probably to start at, I don't know, 7 o'clock in order to get here at 10 o'clock, right? And then think about what influences the choices, their transportation choices of how they're going to get here, how she's going to get to school, how she's going to get to work. She shared yesterday that she is an athlete, golf, I think for Special Olympics was one of them. And she, and bowling, okay. And she shared with us that she doesn't think she's going to be able to continue because she doesn't know if she can get there. And she tried to get to practice and it was 2 hours. And by the time she got there, practice was over. So that's a problem. And so we need to make sure that we are equipped, whether you're a planner, an engineer, what role that you may step into for your agency, that you can kind of somewhat customize and make sure that we have diverse mobility options. And I'm going to kind of zoom some of these and just kind of pull out the points. A lot of the challenges is that we're probably unaware of what type of mobility options that we have, right? I don't know that everyone in this room knows what options we actually have all across the valley, right? Because this area and the landmass is huge, right? And so new things can pop up. You know, I was sharing my journey yesterday that you guys have that Waymo autonomous vehicle that's running around here. We know there are a couple places. And my journey here was kind of difficult this morning because the Waymo kept circling around and it did not pick me up. So I had to find another option, which made me late, right? But I thought that was going to be a great option. I just unclick it, get in the car, you know, and it didn't work out for me yesterday. So I had some challenges yesterday. And so those type of options are included though, because they're a part of our network of mobility and transportation in the Valley area, right? So, but that might be a great option that we think that Diane can just order real quick and she can hop in and go.
My twin sister, she tried it, and because I guess they're offering like $5 rides between this time and this time for a month or something. And she said she loves the Waymo car.
Okay, so see, that might be an option, you know,
But it's still kind of gonna be expensive normally, so that's the problem.
right. So I also talked to a customer that said they thought it was 20% higher than Uber. And so I guess it depends on where you're at, but that is an option, right? And that may be part of my customer persona, and I'm going to get into that in just a second, right? But you know, again, it's difficult to provide options, okay, that are a lot of times convenient and they address, you know, a lot of the challenges. So there's also a lack of understanding, right? and kind of understand the travel patterns. The Valley has a lot of travel patterns, and people come in, and part of the year people come in as just visitors. People come in for special events, for Super Bowl, for the NASCAR thing is coming up. And, you know, your population jumps up like 10,000 more people, and where are they going? Right. You know, and those people are everyone. It's not just people that are able-bodied, you know, and so we have to think about those patterns, and those patterns shift, and they shift from month to month. So that makes it a lot more challenging, right? But we still definitely have to have diverse modes, and we have to understand all those different type of passenger, those personas, because they may come from a big city and they expect to come here and they expect to take public transit all the way around, right? Or they may be coming from a small rural area and they have no idea how to use it. I'll get to that. Well, that's just picking the mode. Well, so whether I want a bike, whether I want to take the rail, do I want to take a scooter, do I want to take an autonomous vehicle, things like that, okay? But we really need to look at the patterns and also look at the hotspots of where people are going, okay? The most traveled path. And I know, you know, MAG, we're here today and they brought us here, they have those different, that data, right? ADOT has that data. Everyone has that data, but really understanding that. And Dr. Harden yesterday stated that, you know, we really need to start layering the maps, and they'll tell us a lot of what we need to know. And that helps us to understand the passengers, okay? Not just the normal riders, but all the different type of passengers that are coming in. So to do that, you have to have assessments. And we know that everyone in here was talking about they've done different assessments, whether it's health assessments, intercept surveys, and things like that. But transportation definitely needs to be a part of that, and the different type of mobility services to help identify. Also, you know, listen to the riders when they're talking about, you know, the certain types of mobility aren't meeting their needs. So they talked about yesterday, the paratransit service changed in the Valley, and they were like, it's really not working for us at all, you know? And then we came to the conclusion in that group that, well, are you guys a part of, you know, those decisions? Are you on that committee? Maybe you can help voice your opinion and state, well, this is what worked for us in the past, right? This is why it's not working for us. And then what recommendations can we make to make sure that we're really, really, you know, serving the customer, you know, and there's not missed trips and things like that. And so that starts back with understanding the customer and making sure that we have a lot of community engagement. Ridership might be low in areas, and I don't think that's a big problem out here in Arizona. It seems to be pretty high. It just kind of depends on which community that you're in. But a lot of times when we go into areas, and like Al was stating area, they went in and they were working on a project in a Korean community that was aging, and they were like, you're going to have microtransit. And they were like, we don't want microtransit, right? Go ahead.
That other guy was talking about microtransit is, so what is the, and he was saying, I think some people didn't want microtransit. So what is the microtransit?
Oh, so yeah, let me define that. So microtransit, it can be defined in several ways, but it's just, I like to call it, it's the old school kind of like circular, right? It's not the fixed route. It's kind of, you know, on a certain schedule, kind of on the demand, so what, and that can kind of be used interchangeably. So it's not going to be your routes that you have running like Valley Metro has now. It's just kind of in a certain area. Sometimes it's zoned in certain zones. So maybe it's only zoned in certain areas of Tempe or certain areas of downtown. And so that's what it is. So it's just kind of a smaller form of service. And sometimes it works and sometimes it doesn't, right? Because it's microtransit is not going to take you to your major destinations, right? If I want to get here all the way out to Chandler, microtransit is not going to do it for me.
But where is there microtransit? Are you saying there's places that have it already?
Yeah, there are places that have it all over the world. I can give you plenty of examples.
Not here.
Not so much. Well, yeah, I was going to say, and then
Surprise just implemented We Ride.
yeah, I was going to say Surprise has it now. So that's the only one that I knew of. I didn't know about the one in Glendale.
Sorry, if
Okay.
I could just remind folks, for the benefit of those online, if you could please use your microphone. When you press that button and the green light's on, then folks online can hear you. Thank you.
Yeah, so we have one that is the We Ride in Goodyear, Avondale, and Surprise now. And then we have another one in Chandler as well.
Okay. So there are those that are out there, but those aren't going to get you all the way across the valley, right? They're not going to take me out even to like Black Canyon, or they're not going to take me out. That's not going to get me there at all.
I think what's important to note is that microtransit will look different in every community.
True.
It is
True.
not what, there is not a common definition. It is what audience are they trying to serve? It is a microcosm It is more of a confined environment, but it is a flexible transportation system that will fit within that environment and the needs of the people it
Right.
is particularly trying to reach.
Mhm.
Does that help a little?
Yeah, that's exactly right. And so we want to make sure that when you're engaging the community, you know, a lot of recommendations are establish certain guidelines and certain goals. And also making sure that, you know, you're very open-minded. There's not going to be always one kind of one vision, right? You have to be flexible. So there may be A, B, and C. You know, you can't just go in and say, this is what we're going to do. We're going to have microtransit and it's going to work. You know, and then that will automatically turn people off. So if I go into downtown Phoenix here and I say, we're only going to do a microtransit system around here, and it's just going to connect to the rail, and we're not going to have anything else. Valley Metro is not going to run through here at all. That's going to be a problem, you know, for those who relied on the fixed route systems. Also, when, you know, you need to think about that, be realistic when you're looking at the planning and the design phase. When you go and you're having these community meetings and you want to, you know, develop or enhance, find something new, maybe you get a pilot project, maybe you get some new funding, you know, you got to look at what the outcomes are going to be and the outcomes that people can actually see that there's something they can actually get on, they can actually ride. That makes a huge difference. And then make sure that there's action that's taking place. You know, I talked about this morning that, you know, you can make a plan and you can sit on the shelf and it'll grow dust, right? Or you can develop it and you might actually put it in, you know, to action. But it's very, very important to have a goal and to have make sure that you actually implement it. And then you want to make sure that when you're doing your community engagement, that it's low cost. You know, there's so many different ways that you can do things. And I think it was Annie yesterday that shared all the different partnerships and the ways that they actually engage the community to get the data and the information they need. And that was really, really great. I would recommend, is she in here today? I didn't see her. I think she's online, but I would recommend that, you know, network and share. And she invited everyone to come and see how they did that, because the same thing can be applied to any of our organizations.
Can you repeat her name or organization? Or can
Yes.
someone help us connect to her?
Yes. It's Annie. I think it's, did I say right? Demundi?
Right. She's on the agenda
Mhm.
for day one. And we can send out some contact information.
Yeah, I didn't want to
And
say her last name wrong. So
I know it's Annie Demood.
Daymood. And to add some context, she and her team lead the health assessment for the county through the county public health department.
Right.
So
thank
she
you.
would be very, very helpful. She had some very good ideas and innovative ways that they were able to engage in the community and making sure that the decision making is equitable and it's fair, and then tying in all the demographics. And so that leads into establishing the partnerships, right? And meeting with all those community-based organizations and making sure that you don't just go to them and kind of like this meeting today. We're just going to have this one meeting and that's it. And we're never going to talk again. And what does that do? It does nothing, but making sure that we keep up. So Dr. Hard recommended the working groups. Some of you are going to start, you know, adding people to your committees and, you know, virtual meetings, and making sure that you're constantly touching base, that you're actually keeping your word and looking at how we can integrate our programs and our plans. And then also pulling all our different people that we serve to making sure that we are engaging all of our different people in the community. So a lot of times we say, well, we invite them to the table, but they didn't come. And okay. But maybe, you know, I need to talk to City of Glendale and say, what groups are you working with? And you can get them to come in that part of the community.
Yeah.
And that's the way that we need to do it.
We've got, I'm sorry,
go
may
ahead.
I jump in?
Yeah, sure.
We've got Eric online, Eric Boyles. He was here yesterday. And he's offering to give kind of a quick description of the outreach that they did with their microtransit program that might be helpful given.
Yeah, sure. Go right ahead.
Eric, do you want to go ahead and unmute?
Sure. Thank you, guys. So when we decided to launch our microtransit pilot program, we knew that you know, there was going to be some challenges that we faced trying to get the entire community engaged. So just a little bit of background: our pilot program that we're running only covers about a 9 square mile area within our city. So what our marketing team did is some targeted communications, both social media wise, on our website, to kind of identify that area and engage residents in the pilot program area, as well as we kind of took a word of mouth approach, with our council. So we had at every one of our council meetings leading up to the launch of the program, we had flyers, we had them talking to their residents at their community meetings, bringing just awareness to the launch of it. So we kind of attacked it from both different ways.
That was which city?
City of Surprise.
Excellent. Thank you. And Al Benedict also put a link to a universal mobility learning module, and we will share that with the follow-up materials after the event as well. Al, is there anything that you'd want to say about that or no?
No, I think, I'll save the floor for Anjali, but there's a lot of really interesting microtransit. They're even kind of moving away from pilots now, because they are, a lot, there's across the country, you're seeing these solutions, and sometimes they work, sometimes they don't. Really tying back to what Anjali is saying is understanding the community, the needs, and planning, appropriately is critical in that process.
Oh, that's great. I'm glad that you're able to share an example. So I love that, especially if it's ones that we're not aware of. And so that ties into what Surprise was saying, all the outreach that they did and try to get people to engage, and then developing these personas. So there are a whole wealth of different types of ways that you can develop passenger personas. If you go to the learning module and there's references, so you don't have to reinvent the wheel. You actually will click on a document and it will actually pull this up. There's various articles. And so this is just one example that I pulled out, but with MBTA, but how do they experience? Okay. And think about, how Bob gets to work, what Bob does, what type of commuter he is. Same thing with Rachel. So Bob's a commuter, Rachel's a tourist. So they're gonna be going different places at different times. Does she maybe come out to Arizona twice a year, things like that. So developing that persona. And I know this sounds funny. You're like, well, we can have a profile for everyone, but just kind of like in various groups. And that's very, very important, understanding your passenger. And then looking at Lisa. Lisa's a teacher. She lives in the city. Very different. Okay. So Lisa works part of the year. And I know some schools out here are 24 or 24/7, and some of them are off in the summer, but maybe she's off in the whole summer and she does something different. So that is what we're talking about when we talk about understanding the passenger and developing the personas. And also we just touched on the marketing and the outreach when it's a pilot and then transitioning to an actual system. Then we're going to touch on the customer service. I think I only have a couple more minutes because we want to get to questions. So I'll try to zoom through these. Good customer service is everything. We talked about that yesterday as far as how when people are calling in, all the way to the dispatch, all the way to how drivers interact with customers. Super, super important. We talked about when we presented this before at SUMC at the conference that, the first point of contact is your driver, or maybe if it's a station attendant. Even the first point of contact might be the TVM machine. And if that machine doesn't work, or if it's, it's kind of like a robot, like what Al showed earlier, if it's not giving the right information, then that's a problem. And so that can automatically, just kind of like turn the customer off. And also wayfinding, the signage. Diane was talking about, wasn't for sure about crossing the street and all the construction going on. I know we were in Kansas City a couple of weeks, they're extending their light rail, and it is like mega construction everywhere. You could hardly walk or drive. And so it was very, very difficult to kind of get around and made it kind of hard. So certainly there were some areas we weren't very sure of how accessible it was. And so making sure, but there wasn't good signage to kind of reroute us to even walk around that area. So we're just going to kind of touch on each of these. Customer service is all about information, how they access it. The operators be in the front line, and also complaint process. We talked about that yesterday, the whole compliance, and when they're addressing, any type of complaint, are the complaints heard, right? Do they need to form a committee? Every complaint's going to be different. Do they understand the process? Is there a QR code where I could just say, hey, I'm having some difficulty. Is there a whole form I have to fill out? Things like that. It is a case by case thing, but we need to look at those complaints and look at, is this a constant complaint, and how do we address this for our customers? And then it's certainly making sure that everything is compliant. They are receiving public funds. And so it's important that, that you are in compliance. Any challenges with customer service? Customers rely on the operators, the drivers, station guides and such. Any information that's not correct is very, very confusing. When they change a route, they don't post it or they don't put it on the ITS sign. And all of a sudden you get there and you think that your route's supposed to pick up at 225 and then it changes to 245. That makes a huge difference. When the drivers, have you ever been on a route on a bus and you ask the drivers questions and they don't answer you? Or they're not sure, they don't know where they're going. Has anyone ever experienced that? Yeah. So we were down in Mississippi one time. I get on there and I was like, hey, I think this route's supposed to take me here and I want to transfer there. And he was just like, yeah. And I was still lost because there was also construction out there. So when we met with their CO, we were in this meeting. I was like, hey, I was trying to ride your route. And I wasn't for sure to get off the regular route to get on the hopper. And if I transfer at the station, whether it was in Biloxi or going to the next town. And I was really confused. So eventually I got off, and who actually helped me was the rider. And he was like, oh yeah, they changed this and this is what you need to do. And I literally had to walk through like this construction zone field to get back to the hotel. And it was crazy. So when I go into places, I actually write the system and try to navigate, figure it out. And most of them, so I worked a lot of agencies, they're asked for my feedback, but I'm like, that was kind of difficult. And I'm like walking through, so, but he just didn't respond. The guy was like, yeah, I think it's where you're supposed to let go. And that's it. So, also, as an agency or an organization, as a nonprofit, some nonprofits in cities, they ask for agencies to put a bus stop in front of them or in their area because they know that their customers are coming there. And so I know KCATA right now, they have this new program where you adopt a bus shelter or a stop and you maintain it. Make sure it's accessible, make sure it's clean, and that's fairly new. And so it's not just the agencies, like you all are, definitely required to make sure that it's accessible for the people that are coming to you that you serve. Okay. So just keep that in mind as well. If you have that MOU or you have that agreement, that's part of your job as well. So recommendations that we had for best practices, making sure that you're communicating with your drivers and your operators and all of your planning staff. And that, as Al said, it's not just in silos. Always have the attitude that the customer comes first. So if a customer is having difficulty, instead of just looking, you're like, I'm not going to get out of my seat and help them get to where they need to go. There was some discussion yesterday about how they may not take customers door to door, or especially if they can't see where they're going or they're having issues. And, there's two sides to that because the driver, may not feel comfortable, but making sure that, you just don't drop the customer off in a random spot and they can't navigate, especially if they're visually impaired or they can't hear and they don't know, it's a safety concern. And something could happen to them. So the other thing is utilize all the TA centers. We are all here, okay? We have plenty of Federal Transit Administration centers, and that's why we're here to help you all. You don't need to reinvent the wheel at all. So if you're like, I need a plan on, a customer, persona, customer persona plan, right? We're like, okay, great. We can pull a sheet, someone has this, or understanding passenger checklist or an assessment. We'll find it for you. We'll find an example and give it to you, right? Make sure you definitely evaluate the ADA guidelines, okay? Looking at design, the environment, everything. Everyone should be well-versed in ADA, whether you're a planner, engineer, any of that, to make sure that there is nothing that is missed, okay? And then wayfinding is a huge thing. Everywhere I go, a lot of times, and I'm sure you guys see this in just day to day, even when you go into like a retail store, you're like, just so simple if they just had a sign and I could just just find it, right? That's the missing link. It's like, where's the sign? In airports, everywhere. All you need is the sign that says where you need to go, and just that simple. Those are simple things, and that you have various maps, educational tools, just anything. Al talked about the app. It's a scan code and it tells me where I need to go. Just the simplest things that you just print those and stick them somewhere.
Anjali, can I ask a question? So I'm wondering about ADA guidelines specifically related around construction zones.
Mm-hmm.
So for example, as Diane mentioned, the light rail station out in front of our building is under construction.
Mhm.
Well, the light rail is not under construction, but there is construction happening on either side of the rail going one direction or the other. So the sidewalk, the sidewalk is impeded. So so in situations like that, where it may be quote unquote temporary, although the construction's been going on for quite a while, what is there a best practice for how you help individuals who may have other disabilities find the right path back to the
Yes.
light rail?
So they are supposed to provide a safe and alternative accessible route. So if the sidewalk is blocked off, they're supposed to, kind of like if you go to New York and they're always in construction in certain places, they will have an alternative route of barriers that is accessible route for people to go around. I noticed that and I was like, what's going on here? So that is what they're supposed to have in any type of construction project. So, well, you know, the city and yeah, so it depends on who's taking on that construction project. So, and that's something that I would contact the city about. And Valley Metro.
And I don't know that it's incorrect. I don't know that what's out there is incorrect. That's not what I'm trying to say. I'm just thinking about, again, going back to the conversation we had yesterday about individuals who are in wheelchairs, individuals who, it's not just inconvenient for, it's inconvenient for everybody. It's more inconvenient for folks who may have a physical
sure.
or intellectual disability who are trying to maneuver that
Mhm.
space. So I
Yeah.
was just wondering about like signage.
Yeah.
Especially
There's-
just like a routine way that I guess it would especially be a problem if it was a routine way that I go every day and then they chained it.
Right.
A
Mhm.
chains would be difficult for me.
Yeah, they should provide a new route, a detour, accessible route, and a pathway, and it should have signage on it so that people know exactly where to go. And especially if it's a route that directly connects to, say, the light rail, then the signage should say, this pathway to light rail stop, this certain stop, so that people with that change are have an easy way to navigate, kind of similar to the route that they did before. That's what should be done. So, right. And if you see those things, sometimes it just doesn't happen. Sometimes it's contractors that do it, doesn't happen or it's missed, and just contact them and say, hey, people are having difficulty. And then that's a quick fix that the city can do. So go ahead.
I was just curious how that translates for individuals who are visually impaired. Because signage, operates in a certain space and then it has some
Right.
limitations, obviously, with that. In the same breath, at a lot of intersections, especially with new developments, the timing of signal optimization, et cetera. There's a lot of places in the urban core that have one-way streets. And so if you're a pedestrian, sighted or not sighted, and you're trying to cross the intersection, oftentimes what you'll have is drivers who are trying to either make a left turn on red or a right turn on red. And if you're trying to cross that crosswalk, a sighted person would be more inclined to look to the right to see if someone's going
Right.
to turn into them and
Then to
also
the
be
left.
paying attention as they cross. But someone with visual impairment does not have that luxury. And they are relying on, audio type of cues to give some kind of warning, so to speak, in terms of proceeding with caution, whatever that might look like. But when we talk about during construction and the pathways changing, and we're talking about signage, I'm just curious, like, how does that translate to individuals who are have a visual impairment or blindness?
Yeah, that's a difficult thing. There are some that, as Al brought up, that where they can provide signage where it's a lot of agencies start to do travel training with visually impaired with an app. And that's able to, where they can download and kind of know what the changes are with construction, but we know that everybody doesn't have an app and is able to scan. And so that's something that really the community has to work with the city on how they can navigate that. And you're right, even some of the intersections don't have like the bird chirps or the sounds. And I noticed that even at the light rail crossings, which I'm not sure why they don't have that, because that certainly was in the plan, I know, long ago. But that's something that why we're in a convening like this, working with understanding your passenger and understanding the people in your community. And those are things that need to be added and recommendations that need to be made. So, and I think that we are running out of time here. I've touched on some of this with planning and service coordination, which is some of the things that you all brought up, which is all a part of that. I'm going to try to just kind of hit on these points and then we'll wrap it up for more questions. I'm looking at pavement, fair pay, which is fragmented transportation networks. We touched on that. I gave an example yesterday that I'm going to share with you all and send out. Kelly Schneider, who's a social service worker, social worker in Iowa, fought for several years as she does travel training. Those that were migrated from other countries, university students from other countries, and then those that were just able to help them navigate the systems and going through 3 different counties, and they all have different fares. And it was very, very confusing to people. So she really, really fought for this universal pass and applied for a pilot for it, and it's working now. Those are things that there are examples of that, and something that maybe you can get in the Valley. So if I'm traveling across all the cities, and I know when I was here in the past working with the cities, I remember being difficult working through Phoenix, Mesa, Chandler, and Tempe, trying to do the BRT and what is it going to cost? And does everyone's systems connect? Even the technology doesn't connect. And so I very much remember that was a challenge for us. And I'm sure with the fare, it is also a challenge. So implementing something like that, so it makes it easier, like Diane says, where I can just show my universal pass and I pay one fare. And then eligibility, making sure that those requirements are similar across agencies. Micromobility management, so looking at the devices that are coming into cities. And as mobility managers, how you're able to manage all of those and being aware of those. Interjurisdictional travel, so we talked about those as well a little bit earlier. And then just the availability of your mobility options. We talked about ADA, paratransit, and then maintenance of infrastructure. So we touched on that a little bit. Looking at universal mobility includes the routes to get there and the roads. I don't think Jesse's here. I don't know if he's online, but like he talked about a lot of his areas, he has dirt roads they have to maintain. And as you go out in rural areas and people want service, and they start kind of putting stops out there, having to get down a dirt path is a little bit difficult. And there's just a stop on the side there. But looking at, creating sidewalks. And then, as you get into cities, sidewalks that are uneven and damaged and during construction. And that poses large barriers. So as I said, regional mobility management coordinators, they can survey those areas, do intercept surveys. Are you riding along? If I have customers coming and say, I'm with a nonprofit and, do I get out there and kind of walk along with them to see what their barriers are and how they get about their day? Also, collaboration, which is what we're doing today, is super, super important. And, kind of establishing that kind of like regional body that helps to coordinate that. And that's really what MAG is. We talked about coordinated fare policies. MOUs are important. When people are like, oh, we can't do this, or we do our own thing, they do their own thing, we don't have funds to share. Develop an MOU of how you all can work together and what each person can bring to the table. And you'd be very, really surprised how you can get things done for your passengers and for the clients that you serve. I always say the 2 heads, 3 heads, 6 heads is better than 1. And that's very, very true when it comes to universal mobility. We're all striving for the same goal, and we all need to understand our clients who are also the passengers. Also, we talked about sharing data yesterday and sharing all of our information. So I think we're going to have more conversation on that a little bit later. And also making sure that there's an inventory where we can identify the gaps in the area. And then definitely, intentional marketing. And making sure that, because people miss this a whole lot, especially in diverse areas, that it's not just in 2 languages or 1 language. I know out here, a lot of times in the Valley, it's always English and Spanish, and that's it. There's a whole slew of languages that are missed, high populations out here in the Valley. And so we need to make sure everyone has to do the title reports for public transit, and making sure that there is more than 1 language that is included on that. Also, policy regulations are very, very important. And then also we talked about CCAM, and Danielle's going to touch on that a little bit later on the Coordinating Council on Access and Mobility. So we'll talk about that a little bit later. So I'm not going to touch on that right now. And then this is my information. On the National Center Mobility Management side, I am the regional liaison for regions 4 and 7. However, I will come out places like this or places that I've worked previously to help you guys out or answer any questions as well, and work in a few other regions. And Amy and Kelly have my contact information. And so certainly email me, give me a call. You all need anything.
Mm-hmm. Jana, do you have a question?
Yeah. And
I'm sorry I wasn't here yesterday,
That's okay.
so this whole topic may have been covered, but I just wonder where weather considerations come in, if at all. And if it was discussed yesterday, I can follow up with the notes from the recording.
As far as
example is, whether it's snowing in the east or whether it's 120 and you're at a bus stop for an hour. Are there any considerations in transportation planning, particularly for people with mobility issues, to
Mhm.
help keep them safe from weather hazards?
So I do know in the past, and I think they're continuing to work on this, when we did light rail, we did some of the BRT stations. We worked extensively on shade design and looking at the heat islands across the city and how we situate the stations, and they have the tensile structures, even down to the touch, like you don't want to sit on it and burn people, how the light reflects. And I know a lot of times it is when you're designing those things, it's the cost, right? Because it gets really, really expensive to manufacture things, that are renewable, but that doesn't matter because the customer's first, right? But that is taken into consideration. But that also goes into the planning and the coordination of, how frequent do your services come, right? Because passengers, it doesn't matter if they have an illness or not. No one wants to be sitting out there for 45 minutes when it was supposed to come 20 minutes ago. And they're exhausted in the heat, right? So that is taken into consideration, especially in places like this. And I know you all don't get snow here, but like Flagstaff, they get snow and things like that. And so that's all taken into consideration, of course. But as transportation planners, I'm sure that that can certainly be looked at a lot further.
That's a great, Angela. I would add too, like, I think, because, like designing so that it is a comfortable environment. There was an example though in Chicago, a friend of mine, there was a bus stop that was kind of in the middle of the road. there was no, covering anything. And he wrote a letter to the paper, to the Tribune at the time, and they published this editorial. And the next day there was a bus shelter there. And so really sort of understanding the voice, your voice and how you can affect change is plays a role in all this, and mobilizing community groups that have that constituency that can look to some of these solutions or empower some of these solutions.
Amy, can I say one more thing to add that I know that Dave has something? The other thing about the shelters here, and I noticed that maybe because it was extreme heat, so some of it was kind of dying, which happens. But when we developed those screens to have green screens, because that provides shade, it provides a cooling effect, and they do provide a lot of those in areas in this region, California, Arizona, to kind of help cool the customer. Some places have misters on their lines that can be kind of expensive, but there are different types of cooling effects that I know were designed and provided to kind of help with that when people are just out there for 10 minutes or 15 minutes as well. Or fountains are provided, water fountains. So those are all thought about in the design. And, sometimes they're put in at, different stages. But that is something that we definitely keep in mind. So I just want you to think that's not an afterthought. So
Thank you. So I have
Yeah.
Dave and then Dee Dee. Dave, did you have something?
Okay. When we think of bus stops, though, when we think of shelters, we're often thinking about your larger fixed route systems that are developing that sort of thing. But if you're a nonprofit and you're trying to establish a route to go pick up people, you've got to be more creative and you got to think outside the box. So you're not necessarily going to build an expensive shelter or have an actual fixed stop. But that doesn't keep you from thinking creatively about where you want to stop and talking to, for example, maybe there's a Walmart or a Target that is right there, and you can talk to them and say, hey, we're going to create a stop here, and we want to make sure that when we come, will you allow us to stop in front of your store? And maybe the folks that we need to pick up could find shelter inside your store for a few minutes until they need to get on our bus. There's opportunities to think creatively here, I think, so that we're not always talking about paying money to build an actual shelter, but maybe we think creatively about what does a stop look like? What is a transit stop? And how can we do this more creatively to serve the people we need?
And that's true. We talked about that yesterday, all the strip malls and hubs at the reception, that there's a lot of those that can be used as transfer stations and stops, especially in the rural areas.
Absolutely.
Yeah, that's a great point. And yeah, looking at, you know, a lot of the examples, well, the module digs into not just urban examples, but yeah, thinking creatively. And you know, a lot of times Walmart or these, you know, retailers may even help provide some amenities for the, you know, because they're really bringing customers to that location and making it easier. And so I think, but yeah, no, that's, you're right, kind of thinking about partnerships within the community that can help to foster, you know, safe places for waiting for a bus or waiting for transportation.
Thank you, Aldidi.
I just wanted to add, there's a great example in the Northwest Valley where a nonprofit agency partnered with the hospital. They had a bus stop, but they partnered with the hospital to build a shaded shelter or fund a shaded shelter. And it was met with, applause. They had a news release, they had photographs, they had a ribbon cutting. So that is a great example of partnership. But you brought up a really good comment regarding the heat, especially in Arizona, especially, in our concrete jungle. I was recently on a training with that included speakers from FEMA, and they had brought up that they were talking about natural disasters and planning for those individuals, the vulnerable population. But one of the speakers brought up, why isn't heat part of the natural disasters conversation? Because we see a lot of fatalities that come, and it affects those older adults and persons with disabilities in unique ways. And that was part of the discussion. I hope they continue that discussion, but I just wanted a great observation with you, but that was something that was brought up on a national workshop that I had attended.
Thank you for that. I was with FEMA Homeland Security for 8 years, so I think I'm still thinking in those. But he is one of the 18, so I'm surprised the FEMA person didn't know that. So, but thank you for bringing that up.
The last thing, can I share? So the shelters that you'll see, some of them around that have that plastic grate that are heat proof. Don't ever hesitate. Those students that were here yesterday, I don't know if some of y'all got to talk with them. I had to speak with them because being, a former professor and doing things like that, they could be your best asset for nonprofits and for transit agencies, okay, and planning organizations. How those shelters were designed that are still hanging around in Mesa, and there's some stops here in Phoenix, is Darren Petrucci, which is a professor at ASU who also runs AIR. He had a research product and acquired funds and was able to build those grates and help design those shelters. And they partnered with our firm, partnered with Valley Metro and City of Phoenix. And that's how they were able to do that. So I know a lot of that times that cost, but just like those students were doing, there's competitions, there's easy, I kind of want to say almost like free ways where it's expensive to get that done. And it's a learning tool for them because those are our future. Like Jesse said, we're gonna be retiring pretty soon, some people, and they're learning, but they come up with some really innovative things because, they're right there embedded, boots on the ground that we may not think of. So I just want to throw that out there. Darren is still around here in the Valley, and they've done a lot of work on shelters and transit design. They worked on the light rail. And so partnering with nonprofits and agencies and things that way, they're really good about that. And that's a way that you can help your clients and help understand the pastor. They can do a lot of that groundwork. And I know we have to move on, so we might have to answer it afterwards, but okay.
I just wanted to comment or add to what you had shared, and I'm sorry, I forgot your name. I apologize, David and Dee Dee had shared with regard to kind of taking a different look at what a bus stop looks like or redefining it. And so, and then the natural disasters, framing the heat. So I think one of the conversations that could likely happen in that conversation about redefining a bus stop is starting with something people are familiar with. So when people board aircrafts, one of the most common phrases is, we're going to give a little extra time for people who need a little extra time to board. And that's typically people traveling with small children or elderly or someone who has a disability. And so I think that can be kind of a natural segue to saying, what is the opportunity to allow a place for people who are riding transit, for example, someone traveling with small children, someone who's elderly, or disabled to have a place to kind of rest while they're waiting for the light rail or the bus to come by. In the same breath, with regard to the heat, it's also a natural segue to concerns about dehydration, especially in the heat. And so almost viewing it almost like a hydration center or hydration station for people while they're waiting so they can get access to water in the heat. So I think there's kind of an interesting nexus that could happen in that conversation.
Yeah, one of the things, just to follow up on that, we've been thinking about that, and these could be big or small, depending on the context, but resilience hubs and the role those can play, in those times of critical need. So they serve, a lot of different functions, from a meeting place to providing mobility service, connections, but then also, times of, crisis, they can be that place that, through alternate energy sources, that are able to still sort of function and keep a neighborhood up and running. So that's, again, those are kind of vary in size and scale, but even this, there's different work that's been done on that now.
Excellent. Thank you so much to Al and to Anjali for sharing your expertise. We also, Al put his email address in the chat. We'll go ahead and send that out with the rest of the materials after the event. Are folks ready to transition into the next session? Do you need a quick, are you okay? Okay, let's keep on moving. Dave, the floor is yours. No break. It's all you. Thank you. Dave will be talking about how do we integrate our plans, and I'd encourage us to use kind of the word plans a little bit loosely. So it could be plans, it could be activities, it could be how do we communicate better together, how do we coordinate, basically how do we take all of the great information and connections made at this event and how do we move forward with it. So with that, Dave, the floor is yours.
There we are. I reflect on yesterday and today, and you folks do this transportation work every day, and you are down in the weeds and you are working with particular issues with clients, particular issues in your community. The danger is that sometimes you can be so far down in the weeds that you could potentially narrow your perspective too much. And so what's happened yesterday and today is we're giving, hopefully, the opportunity to lift up our heads and look around and say, who else is dealing with what I'm dealing with? Who else is in this transportation space? What opportunities do I have to learn and inform my work? And so that's kind of where we need to start today, is taking that deep breath and saying, okay, who's here? And so I reflect back, and the most recent session on universal design, I think, okay, why do we need to care about universal design? And I immediately jump back to yesterday. And we had Ed stand up here and he talked about 4 words that he thought was really important. And I go back to those 4 words and I think of the universal design in terms of those 4 words: community, partnership, the human element, and transportation. And I think, okay, in terms of this universal design, which can get so technical, how can I stop and put a name and a face to it? Think about some of the clients that you serve. Then interpret what we mean by universal design. How is it helping Andy, who Al was talking about? How is universal design helping Diane? How can that take that concept and bring it down to your work and what you're doing every day. When we do that, then we can start thinking about how every trip starts with rolling and walking, which was another comment yesterday that really hit me. Then I think about, so when we're talking about all this data and technology, why do we collect all that? Is it because we've got required reports that we've got to file every month? So the next question becomes, how are you using that data? Do you mine that data to learn again about your customer? And can you put a name and a face to your data that you're collecting? What are you learning from the data that you mine and collect to inform your work and help what you do to do it better, to do it differently? And then when we talk about, you look at your agenda and it says Dave's going to talk about integrating plans, right? Okay, Dave's going to talk about integrating the plans. Who's responsible for integrating the plans? Is it Mag because Mag convened this meeting? Integrating the plans is really, I'm going to throw it back to you and I'm going to say, what have you taken from yesterday and today that you are going to integrate into your work, that you're going to integrate into your plans that will then impact Maricopa County, impact the greater region? What does that include? Pima County? How do we change the region to better serve the needs of the people who live here? That also means we need to think about who lives here. And we need to think about who's at the table and who isn't at the table and what voices, because when we talk about integrating plans, we naturally need to think about inclusive planning. And what do we mean by that? And what does that mean for my agency or my work or my plan if I'm working in healthcare, if I'm working with the developmentally disabled, if I'm working with the homeless, if I'm working with a faith community? I've got to think about, what does inclusion mean and what does it mean to integrate some of these ideas into a plan that not just serves my agency, but now I can think about how it coordinates and integrates with others in this room. So again, it's lifting up your head and thinking about what you're learning and what you're gaining. It's funny, I started with this whole outline of what I wanted to do, but as I listened, I changed the whole thing. So I've got all these notes scribbled all over this paper to go at this a little bit different way, because I realized that it's all about what value do I as a person bring. And we talked about this a little bit yesterday. And it was this pre-survey that Amy talked about and Kelly talked about, and it was a willingness to participate. The firsthand knowledge of challenges that you bring to this conversation, your curiosity, your experiences, your insight, and the different voices represented in this room. So the challenge as we integrate is, I want you to think of 4 things. I'm going to go to 5. Number 1, someone that you're going to follow up with. This is your homework. Someone to follow up with based out of what happened yesterday and today. And there was some beautiful eye contact in the last couple of days. We saw it just in our panelists that were sitting up here. They heard each other's presentations and they went like this to each other. We're going to call me. So who are you going to follow up with? A key idea or two that you gleaned that you can put into action. A plan that you heard about that you want to read or become more familiar with. It's not your own plan, somebody else's plan that you heard from one of these presentations. An internal meeting to discuss, and when I say internal, I'm thinking about go back to your organization. Have an internal meeting with your team. What are you going to share about the value from yesterday and today that is going to inform your agency's work? And number 5, is there something else I didn't cover that you want to do? Now, I want to take a couple of minutes. I've given you 5 things that you can do, and then I'm going to ask for some brave souls to share. Okay? And we're not leaving until somebody shares. Okay? That's right. But we've got some great folks in this room that I know have been taking notes. I'm not the only one that has been scribbling. So the idea is, what can you do? Let's go over to someone you want to follow up with, a key idea that you glean that you want to put into action, a plan that you want to read or become more familiar with, an internal meeting. Who are you going to meet with? What does that meeting look like? Or is there something else that I haven't covered? So let's just take a couple minutes to think about that, and then we'll get started. That's for the folks online too, by the way. Or something else that I didn't cover, something else that I didn't suggest that you want to do. So that 5 is kind of optional. If I covered it, great. But if there's something else, feel free to throw in a number 5. How am I doing? Need one or 2 more minutes? Are we there? Okay, 1 more minute and we'll get started. Okay. With that, who wants to start? Who's excited about something? Yes, I love it.
I'm really excited because I wasn't here yesterday and I've learned a lot just in the hour or so that we've been here. But number one, someone to follow up with, Annie Damude, who now I realize I know her. So I need to see what she talked about. Also, Eric Boyle, who is apparently watching this virtually. I don't know if he's still on, but we have an effort with City of Surprise coming up with the
Nice.
Human Services Department. And so to make that connection, because transportation has been identified as a major issue there among elders. And then also Dee Dee here, because I want to find out more about the work she's doing with FEMA. Key idea that I can put into action. There was so much in the universal design piece of understanding our passengers or our people. And I guess I should have started by saying I work with YWCA Metropolitan Phoenix. We serve seniors, thank you, and people with disabilities through congregate and home delivered meals. And then we also have an advocacy and equity lens around race and gender equity, where we do a lot of policy work and what have you. So one of the key ideas is really to share with my colleagues this understanding passengers or our customer base as it relates to their transportation needs. Number three, plan to read or become more familiar with universal design, because I was really excited about that. Internal meeting to discuss or inform agency work. And again, around equity, the policy work and our work with seniors, how can we ensure we're incorporating these ideas that we're picking up? I think a colleague of mine was on yesterday on virtual. And what I feel, maybe it was covered, but I just want to say that this whole idea of the impact of lack of transportation on people's mental health in certain communities is an issue that we are really concerned about, particularly as you look at it through an equity lens. Anybody who lives in the Valley knows, and maybe this is nationwide, that there are stark equity considerations when it comes to transportation, whether it's rural, urban, whether it's ethnic, whether it's racial, whether it's people with differing abilities, whether it's people with different languages. And so to really understand how not being able to access transportation is impacting the mental health of people is something that I think we're going to be following up on at YW. So thank you.
I love that, because what you've just done is you've identified another voice that you want to bring to the table.
Oh, I would say that I definitely affects my depression because I think that I can't get anywhere that I want to go. And I get so frustrated with the transportation that I just stay home and isolate myself all the time because I don't have the patience for it. Like that makes me so anxious when I'm on dial-a-ride for 2 or 3 hours. Then I say I'm not gonna do this again. So I'm gonna quit what I'm doing. So
Yeah. Sometimes it helps to think of a specific individual who represents the type of audience you're talking about, right? Because then you can start thinking about what kind of ideas or plans would help someone like her or like him, right?
And interestingly, we're doing a listening session with Special Olympics of Arizona. So I need to make sure I get your info too. I'm sorry I missed Gianna. I guess she was a speaker yesterday. So we'll be really looking forward to hearing from the Special Olympics community on this issue.
Mhm.
Thank you.
Yes.
I'd like to offer a big look at this and then a small look at this as well. So from the macro perspective, MAG and Age Friendly Arizona would be very interested in having regional plans hosted on our website. So if there's a place where everybody can come to one spot to find the different plans that are in place,
Super.
and possibly without signing us up for too much, continue the conversation, figure out a way to continue the conversation and keep it as diverse as possible. So yesterday we talked about how there was an individual, and I'm sorry, I forget your name. Jasmine, thank you. She shared with us that individuals who have lost their sight or are not able to see
Mhm.
often need someone to walk them to the door.
Yes.
Having them just providing the transportation is insufficient because they're in a new environment and they may struggle physically to get to the door of wherever they're trying to go. And what does it take training wise to get the driver and the customer, the consumer, to be able to have that open communication, to be able to, so everybody knows what the expectation is and that it's done safely.
Mhm.
And we talked about how drivers need to be a part of these conversations also, right?
Mhm.
That it's involving both parties, because there could be that driver may have had some security concerns of herself or his self of getting out of the car and doing that. So
Mhm.
there's another human there. So I would say from the big perspective, I think Age-Friendly Arizona can become an area where we can bring together more of the voices that we've heard over the last 2 days. And
Mhm.
from just from a human perspective, what I would encourage everyone in the room is to find someone you know who is struggling with public transit. Find someone who needs it regularly and ride it with them. Ride it, whatever that looks like. Pick a route. Maybe it's a new route for that person and you
You-
can help teach them or help guide, walk alongside them and what that route looks like. So it becomes more familiar for them. And if there are issues along the route, write them down and figure out who they need to go to, who those comments need to go to. Because if it's just, even if it's just that one person and that one route, that's how the system gets better. It's that feedback loop.
You know, it's a wonderful point. How many of you have ridden your own transportation system in the last 6 months? That's wonderful because it's an ongoing opportunity to learn, right? To see what the others are going through on a daily basis. That's wonderful to see so many hands go up. Congratulations.
I would say one more thing is that like because of the timing, that if like the paratendant has to drop me off like so early somewhere, that it could be an unsafe environment because I might be like stuck in the middle of nowhere where there's nowhere to go because the place that I'm going is not opened yet or whatever. And,
Mhm.
or then even and going places at night. I guess my mom's like, I really don't like you going to Special Olympics things. I'm afraid you're gonna get stranded there. And I did take my dad on. I took my dad on dial ride one time, and then he didn't want to do it anymore.
It gave him an appreciation for what you go through,
Yeah.
though, didn't it?
Yeah.
Okay, who else has something to share? Don't be shy. Yes.
Hey Dave, I would like to share something. I'm a local jurisdiction transportation planner, and my takeaway from this great event is I heard different perspectives from our nonprofit, our different organization, or even those individuals. For example, yesterday, I'm sorry. Oh, thank you. Awesome. Can you hear me now?
Yeah, it's much better. Thank you.
So from yesterday, I went to a breakout room about the ability 360 conversation for the differently abled service plan. And I have an opportunity to hear those different individuals talking about their perspectives, their experience. For example, like Diane shared before, like what their challenge or different situation they face to the public transportation. So as a local jurisdiction, I think that's a great takeaway for me to focusing more on those situations make our plans more inclusive, and our future plan or even grant writing process, like how to reach out to our folks, like for a better understanding for their point of view. So I think that is a great takeaway for myself and my organization.
Fantastic. You know, I like the fact that you brought up the grant process as well, because a lot of this comes down to funding, right? What are we going to fund? How are we going to do it? How can we be creative to meet the needs of our constituency? Yeah. Yes.
So I just was gonna share that I was gonna follow up with a variety of people, but
Let's talk about what organization we represent. While
oh, I'm sorry.
probably helpful not only for us but for folks online to know
Yeah.
when we're talking about this, the organization. And let's go back. What was your organization?
I work for Glendale Transportation Planning Division.
Great. Glendale Transportation. Yes. And you, please? Thank you.
Janine Sullivan, and I work for Pima Association of Governments down in Pima County. So what I was going to share was I intend to reach out to a variety of people, but some of the people that are kind of top of mind are Zane Garcia Ramadan, I think is how I pronounce his last name. And then Dr. Hardin and Catherine Newman. So those are a couple, and then of course you, Mr. Summers. So a couple things that really kind of stood out to me that were kind of affirming some of the things that I've been navigating and considering navigating in our region are about like the listening sessions and who should come to the table in different discussions, whether it be our working group or other intentional efforts to reach out to the community and really understand the different needs. So one of the things that I think someone had mentioned was about microtransit and how it can be received in a positive manner or a not so positive manner for a myriad of reasons. And so one of the things when we're working with tribal communities is understanding some of the cultural applications in terms of, I mean, how do you care for your elderly parents and what does that look like? Respect and dignity, all those elements that are important to everyone, but especially from like a cultural perspective and what it might mean to someone to put the care of their elder in someone's hands, like microtransit or conceptually like an Uber or a Lyft, if you were thinking in a different space. So what are those voices that we need to bring to the table to kind of help navigate an awareness and an understanding so that we can meet people where they are, not just literally geographically, but where they are in respect to how they want to care for their aging parents. The other piece is tying in with kind of rider advocacy and personal care attendants and some of the conversations we've had about accompaniment for people who might need additional assistance when they're using different types of transportation modalities. And so in the FTA section 5310 space, the majority of our providers are providing transportation to healthcare appointments, and there's others, but the vast majority are healthcare and mental health type of appointments. And so some of the people that I've been really wanting to bring to the table more fully is the case managers, not just to get their view and their understanding of how things work in the bigger system, but to try to look at it from a lens of how do we become more proactive in helping people identify and plan and gain access to transportation even before they even recognize that they need it versus in a reactive stance. Because a lot of times, you know, Sally's not planning on falling and breaking her hip that day, but it does happen. And so now we're in a reactive position. Those things you can't necessarily, you know, prevent. That life is going to present those kind of circumstances. But if we work with healthcare professionals, we can work with them to build them up so that when those situations arise, they are already in a proactive posture to be able to support and meet the needs of the people that they serve well. So I want to kind of take an angle on that. And then the other piece that I heard with regard to the training of drivers is how do we make the most of all the people that we do have in our own network, but people that we need to add to the network. So I'm very fortunate that I work with so many different health service organizations that bring bench strength naturally based on the inherent work that they do, whether it be serving people with a visual impairment, hearing impairment, or developmental or intellectual disabilities. But how do we orchestrate those best practices and translate them into a variety of different buckets, whether it be travel training, the personal care attendants, the healthcare professionals that I mentioned, but also our hiring and retention of drivers. So I'd like to see kind of all that come full circle. So the different people that I mentioned that I wanted to speak with, that's kind of where my heart and my head's at. So thank you.
A couple of things that you brought up that I particularly like. Right now, this time of year, we come up on a period of time called Older Driver Safety Awareness Week. I don't know if you've ever heard of it. I think it is, I think it's in December. And there are materials that are put out there by Occupational Therapy Association in terms of reaching those folks who are going to be your next riders. because you know that within the next little while, they either shouldn't be driving or they won't be driving soon. How are you reaching them? They've got a whole campaign, I think it's called You Hold the Keys. So the whole idea is put a positive spin on it, because what you're trying to do is help older people, people with disabilities, maintain their independence through using your type of transportation system, right? You're not trying to take away their independence. You're trying to help them maintain their quality of life. And so you bring up an excellent point. Another resource that you might check out is one that we have with the National Aging and Disability Transportation Center on our website. So at nadtc.org, you will find a whole campaign called Every Ride Counts. It's free material for if you're trying to promote your service and you just don't have the money in your budget to actually promote your ride service. You can use some of those materials for free that are right on our website for getting word out about the services that you are providing to the type of audiences you're trying to reach.
The last thing I wanted to add was you had mentioned about kind of broadening your view about who needs to be at the table, and just not necessarily being myopic in vision for a variety of applications. But one of the things we brought to light in our discussions yesterday with the aging breakout session was pertinent to like the sandwich generation, right? People who are empty nesters, or maybe a little bit younger than that, but they're caring for their parents. I'm one of those. So with that, that's one of the other voices that I'd like to have in the
Caregivers.
discussions and the table to help them in where they are today, but also from a proactive stance.
Beautiful, beautiful. Love it. Love it. Okay, who's next? Yes.
Yes. Yeah, my name is Josh Massey. I'm with the NADCC's Coordination Advising Committee. But I also have a company called CarePool. We build software, and this has been amazing to kind of understand the entire scope of everything going on here. But I just wanted to, for context, I guess we have our current app allows to build a customer profile, and like Denver Regional Council uses it to kind of rebook the rides for individuals. But pre-COVID, I had an idea around community collaboration and really just finding a way to have one place to go where everyone can put their own resources in one spot, and really figuring out whether it's vehicles, drivers, how do we create routes that can collaborate together and go county to county. So I decided my action plan is to bring this back. And, I think, whether it's, different payers splitting these different rides, or, just sharing these resources in general, having a piece of tech that can bring this all together. Kind of had to put it on the side for a while, but really just understanding this is needed at a lot of places, and that I've put a plan together to bring that back. So that's kind of what I'm taking out of this. A lot of things I took out of this, but it's been really great.
Along that line, this was something both Catherine and I served on a team that was reviewing some very innovative transportation projects. And one of them that we read, and Catherine, do you remember this one? It was out of Pennsylvania Department of Transportation. And they came up with a way that folks who were needing transportation could go to one place to fill out the eligibility, the qualifications. And this was an automated application that would then identify multiple modes of transportation or transportation programs that they would automatically qualify, and it would send their eligibility information to those agencies to automatically qualify them. So by applying once, they might qualify for Elaine and Valley Metro, and I don't know the names of all your different programs, but you would then be eligible. And instead, because what happens right now? People that want to ride are having to go in and find that agency, find out the eligibility requirements for that agency, call them, apply, and get through that process. And then if they're trying to cross a jurisdictional boundary because they're trying to get from maybe Surprise down here to Phoenix, they're going to figure out how they got to work with this microtransit here, but then they've got to get to the fixed route over here. So now I've got to talk to this agency over here. I thought it was beautiful. And so at NADTC, we want to see what Pennsylvania Department of Transportation can do to get the word out to other DOTs across the country, to other transportation networks across the country. So that kind of innovative thinking can be replicated. So
Did they have a name for that? Was there a name for what Pennsylvania did?
Find My Ride.
Find My Ride. Thank you, Catherine. I knew I could count on you to jump in.
Look it up.
Find My Ride
Yeah,
from
it's
Pennsylvania
Find My Ride
Department.
through PDOT.
But thank you for sharing that. Somebody else. Yes, Elaine.
Thank you. I'm Sam Johnson, Program Manager at Elaine. Thank you. Immediately, I want to say I would like to follow up with you, Josh Massey, was it? And find out more about this software project. That sounds like exactly what our community needs. The other person I really want to follow up with was Albert, who presented this morning. There are several people in this room I would like to follow up with, but I intentionally want to follow up with Albert on this shared use mobility center. I had not heard of that before, and it sounds like an incredible operation. So I would love to learn more about that. As far as key ideas, this ties back into what you're working on, Josh, but putting together some shared resources of information. We talked yesterday about the idea of a software library. I think that could be incredibly helpful for smaller agencies in particular who may not just be aware of what resources are out there. So really starting to centralize the information and making sure that new players who come to the table are given that leg up and that boost in order to provide the help that they want to provide. A plan to learn or read about. I was told yesterday about FTA circulars by Anjali. I'm definitely going to dive into that extensively. Internal meeting, check. And is there a fifth item of our own choosing? Here's where I do want to intentionally reach out to other social services who are in the transportation space. We are aware of many that are not at the table today. I can think of Foothills Caring Corps. We were just talking about CK Community Services, which is literally just a couple who owns a gas station, and they're providing volunteer rides for seniors in this community. So just little agencies like that. Resurrection Street Ministries out in Mesa, they provide free rides for vets. And there's a whole list of just little agencies like that who are trying to get on board and help solve this problem. And I don't think that they're all necessarily aware of what resources are out there. So we would like to start reaching out and bringing some of them to the table.
Nice. And figuring out ways you can work together, right?
Exactly.
Can I just comment on one that she mentioned, which is the potential for faith-based organizations who often do have buses or vans? How many of us are partnering with them or even including them in our planning, where the van or the bus might sit idle for the entire week, but could be used? Because the thing about it is that a lot of those houses of worship are in areas where, I just want to say this, and this will be the last thing I say about this, Kelly, is that the lack of transportation is a structural racism issue in our community. And it affects not only mental health, it affects public health, it affects food security, it affects where you live so that you could get to your job on time. And so some of these small kind of entities that she's talking about are the ones who are in these communities that I think we really need to engage with more in these massive plans to make sure. I don't know if that's happening. Maybe it's happening. Kelly or Amy? Maybe it's happening already, but if it's not, I would just want to put that on the table because that is something that we're never going to get to the equity in transportation access that everybody in our community deserves if we don't begin to engage these micro communities. So thank you for mentioning that.
Yeah. I think, and you mentioned reaching out to smaller communities. When you reach out to smaller communities or rural areas, you have a particular opportunity to connect with the faith-based communities in those areas, and faith-based communities tend to be more segregated. And so now you're reaching particular pockets of the population where those voices have not been included in the conversation. When you get out in those smaller communities and start connecting with the faith-based communities to ensure that you're serving them as well. So thank you very much for your comments. Very valid. Somebody else?
Something that we talked about yesterday in the aging breakout room was that, pre-COVID, if you wanted to be involved in all of these different organizations, the meetings at all of these different organizations, it was nearly impossible because you were going to be in meetings every day, all day. It's just too many to attend because everything was in person. But now that COVID has come and is, lingering, now you have that ability to likely attend these meetings virtually. So you could maybe attend more of them. Most of the time they're recorded and posted on web pages. And so I hope that now that you have, everyone has gotten some ideas of the different organizations and resources that are out there, that, maybe then you could be more present in these different meetings throughout these different sectors. Because you don't have to travel hours or take your whole day out of your office. You can sit in your office and be involved in those meetings. I thought that was a great takeaway.
And along that same line, and I've had this conversation already with Amy and Kelly here at MAG, and that is, if you're not already part of their transportation ambassador program, that's a regular convening. That's a regular convening around transportation. So if you want to continue some of the conversation that you've been a part of the last couple of days, contact them and find out how you can get more involved in that transportation ambassador program to join a regular gathering of people who share these concerns in the region.
Thank you. I was just thinking of that as the next step. I wanted to provide that information.
And you're Dee Dee?
Yes, I'm Dee Dee. Thank you for that. I did not pay him. We appreciate that. A lot of the topics that all of you have discussed today, we're taking notes. And Samantha, you're such a great resource. CK, we just heard about CK transportation because I wasn't driving, but I saw it when I was on the freeway, and I took a picture and I called Ezekias, who is my colleague, and I'm like, there's. So we met with them, and it's a very small organization. It's just 2 people, but we did make contact with them. The transportation ambassador program is really a meeting of like-minded people. The focus is for those that are subrecipients of FTA funding, they have to participate in coordination activities. But we thought, of course, with the great leadership from Amy, why keep it at that and why not expand it? So we invite not only subrecipients, we have people from municipalities. Valley Metro is always a standing item on the agenda. And I would like to invite all of you because they have updates on exactly what you're talking about. If they're transportation updates, service changes, the mobile app, they provide that to our ambassador. They're always a standing committee agenda item. We have the City of Phoenix, who is our designated recipient, who is brings updates on the 5310 program. And then we invite you, if you have a program that you think you need to get that information out, please contact us and let us know. We would like to. We recently had a presentation from AZ Able, which is a savings program for people with disability, because we know there's restrictions on how much you can save that won't be penalized with your benefits. So we just had them. So we invite you, please contact me. I was just sitting here thinking I need to do a PowerPoint slide with the link to our TAP webpage and our contact information. We'll provide it at the end so everybody has that information, but definitely please contact me. We're going to work on a slides where we have that information. But we believe that through the collaborative effort, even though if you don't provide transportation, or you may know a agency that provides transportation, if we all work together, we can coordinate. I need to know what's happening, you know, in the East Valley, West Valley. We don't know all the information. People think we do. We don't. We rely on you to provide us that information. So this is an opportunity. The TAP program is a community, you know, a community gathering is for you to share your information for our service providers and stakeholders.
Thank you, Dee Dee. And I'm wondering too, picking up on Janet's really good point about the faith community. And by the way, there's support for that online too. Just if there is a way that you could feature the faith communities and what they're doing and kind of sharing their needs and looking at the resources, that could be a great session at TAP. Okay.
Can I share? I sent this to Kelly and Amy to provide in the notes. And I know Elaine, maybe Samantha, you all may be definitely interested.
Do you have the mic on?
Oh, sorry.
Yeah. And introduce
Yeah.
yourself.
I'm
for the folks.
Anjali again with National Aging Disability Transportation Center. We got a report from the Transit Cooperative Research Program. They are part of the National Academies of Sciences, Engineering, and Medicine. If you're not a part of that, or the TRB, Transportation Research Board, you can go and you can make a free profile just to stay up to date. They have a lot of webinars and different committees you can be friends of, and a lot of the meetings are virtual. But they have put out some new resources today. They continuously put out resources for research, and one is Homelessness, a Guide for Public Transportation. So that was a new one that's in a draft form. They like to get feedback. So I just want to throw that out there. They have a bus operator, workforce management practitioner guide. They have all sorts of different things. When we see issues like that we're presenting today, or we also see case studies of things that are happening that have been success stories, and people will further research it, categorize it, and they put it out in a giant publication that I think it'd be helpful. So you can really go in on that page a lot of times and put in topics, and you will find a wealth of information for any type of organization. The other thing I wanted to mention was National RTAP also has Tackle, which you'll see the little booklets on the table over there. And that is a resource for you all that you just type in a topic of maybe something that you're looking for, and people can submit research study, case studies.
Let's see, the acronym stands for Transportation. No, Tackle.
The Coordination Library.
And Transportation and Coordination Library.
Yeah.
So it is a library. It's a repository of information. So real quick, I know we're down to the last couple of minutes. Thank you for that. I think, I don't want to put you on the spot, but we have somebody here from the faith community. Do you have something you want to add?
Hi, my name is Janelle Taipisi. We're from Interfaith Community Services. We're based out of Tucson, and we are solely based on faith communities. We have over 100. I couldn't name them all. You can go on our website, icstucson.org. You can see all the faith communities that we work with. I never thought about asking them to help transport our participants. For the most part, we've been asking them to volunteer. So all our volunteers are all seniors, and our clients, they're all seniors. We do a lot of work. we do big work, but we're a really small organization. I did want to meet with, I believe his name was Eric yesterday, Sam with Elaine. And then now that I hear that there's this software genius here, I am all for it. You don't know my struggle. Yesterday, when we did our little workshops, I was venting a lot because software and I are not the best as of friends because of the software that we use currently. So I'm on a hunt to find something that's gonna work for not just for transportation, but also mobile meals and possibly our whole organization, because we do a lot of things. We help with financial assistance. We have our own food bank. We have a mobile food bank. So we do a lot, but the software that we use is not user friendly. And then we also do mileage reimbursement, which is also a bit of a pain because each month I had to verify those miles for those who want mileage reimbursement. And I could go on again in vents, but I'm not going to. But if this is if it sounds like something you could help me with, I'm all for it. I could come and beg every single one of you guys. I just want to know what's going on with your organization, your programs, and I want to take everything from your guys's and see if it'll work for me. And same, I want you guys to come and see my struggle. So if you're ever in Tucson, visit us. We have our main location is on Ina. And then you can also visit our website, and then I have business cards. We can meet afterwards during lunch. I am all for it. I need so much help that it's ridiculous. Thank you.
And thank you. And so in summary, oh, I'm sorry. Yes.
I just have one comment. You are in great luck because we do have a mobility manager representative right in the room. I would suggest that you touch bases with Janine.
Super.
Oh, I will. I promise.
So in summary, when we're talking about integrating Arizona's plans, I think what we've realized that the integrating plans starts with me, right? It starts with me. How am I going to take this information and put it into practice? And how does tomorrow look different from today? Thank you all very much for being here.
Thank you. Thank you, Dave, and thank you all, those in the room and online. We appreciate all of your comments. Really excited about all the great connections being made and super excited to be following up on these after the event. For those in person, we do have lunch available in the Akatia room. Hezekiah, if you don't mind opening the doors for us there. Thank you. Please feel free to grab lunch, connect with each other. We will reconvene at 12:45 with a panel on how do we sustain our work, AKA funding, resources, all of that. So really important panel. We have some great speakers joining us for that. For those, if you're online and close to MAG office, come on down for lunch. We have plenty. And we look forward to continuing this event with you soon. Thank you, everyone. Second day in session. So at this point, I'd like to introduce Anjali Dixon again. She is with the National Aging and Disability Transportation Center. She'll be moderating the next panel on sustaining Arizona's plans. Anjali, the floor is yours.
Right, welcome back. I hope everyone had a great lunch. Thank you, Amy and Kelly. It's delicious. So I'm sure everyone is full, and so hopefully they'll all seek on us. We have some good information for you this afternoon to continue with great conversations that we had earlier today. Certainly, as Dave kind of talked about how we can take the next steps of networking together and partnering and starting to integrate plans. That was a great discussion and led to nice networking over lunch. So we're going to continue to talk about sustaining those plans. I will be moderating the discussion. We have Danielle Nelson with FTA, Federal Transit Administration, Kim Ellsworth with the Verde Valley Caregivers Coalition, and Gabrielle Aramillo with with Vitalist Health Foundation. And so I'm going to pass it over to Danielle to kick off. She will pop up on the screen here in just a second for those that are.
Julie, did you say you were going to pass it to me?
You should be able to share your screen. Okay.
Sorry, I wasn't able to hear. Anjali, can you move your mic closer? We're having trouble hearing online.
Can you hear me now?
Oh, yes. Yeah, there you go.
So maybe I need to start that over. So we will talk about sustaining Arizona's plans. We're going to kick it off with Danielle Nelson with Federal Transit Administration. And then we have, again, Ken Ellsworth with Verde Valley Caregivers Coalition. And then Gabrielle Aramillo with Vitals Health Foundation. Okay, is that better?
Perfect. Loud and clear. Thank you so much. Hi, everybody. I just wanted to share some resources with you all that might be helpful, sort of kick off our conversation. I work at the Federal Transit Administration headquarters in DC. And if you go to the next slide, I'll just jump right in. Most of you in the room are all familiar with human services transportation. I work on a project that works on coordinating human services transportation, which includes a broad range of transportation services and options designated to meet the needs of older adults, people with disabilities, and those with limited income. And basically to get access to everyday destinations throughout the community. And if you go to the next slide. Oh, and the importance is coordinating those because they can be very fragmented if not coordinated. And today I'm going to talk just briefly about one strategy that's involved in coordinating human services transportation, and that is federal fund braiding and the ability that's in federal statute to be able to do that. And if you go to the next slide, and you're talking about plans today, coordinated plans, which is a great opportunity to do some of that coordination. And I thought very important to set the stage is what is mobility management? A lot of other sectors like the health sector might call these community health workers, but we at USDOT use mobility management, which is an approach to managing and delivering coordinated transportation services to customers from a variety of providers. So it doesn't have to be just public transit. It can be human services, transportation, et cetera. And the goal is to achieve a more coordinated transportation delivery system. So it's all about connecting people to the places and the services they need to go. If you go to the next slide. So that project I was mentioning that we work on, so U.S. Department of Transportation leads what's called the Coordinated Council on Access and Mobility. It's an 11 federal member council that was started, a lot of you probably remember it as United We Ride. Back in 2004, it was started by executive order. And then in the FAST Act, Congress put it into our authorizing legislation with several requirements that USDOT is working on today. And the mission is all about issuing policy recommendations and implementing activities like grant programs that improve the accessibility, efficiency, and availability of transportation for those three important populations you see on the screen. And if you go to the next slide. So we, in 2019, worked with our federal partners at those 10 other federal agencies, and we developed a program inventory, which is a database that's searchable, and it shows all 130, and that is right, 130 different federal programs that can fund human services transportation for one of those three populations. And people are usually surprised to know that the agency with the most programs that can fund human services transportation isn't the Department of Transportation, but the Department of Health and Human Services. And one of the things that's key to remember is that, or to know, is that the programs in this inventory, the majority of them, the mission isn't transportation. Transportation is an eligible expense. Like, for example, Head Start. The Administration for Children and Families has the Head Start program, and transportation is an eligible expense. And if you go to the next slide, Congress gave the Federal Transit Administration congressional authority to accept non-DOT federal funds as local match. What that means is if you want to buy a bus, if you want to hire a mobility manager, you can do that at 100% federal share. Meaning you can use FTA's funds for 50% of operating that vehicle, and then you can use HHS funds for the other 50% to have 100%. And that is specific to three programs. The most relevant to you all today is the Formula Grants for Enhanced Mobility of Seniors and People with Disabilities program. And I included the links to the federal statute and quoted it here so you guys have that. And this is since 2005, that this ability. And I quoted the House of Representatives report where Congress added that to law. And it talks about how coordination among these programs improves transportation access. And if you go to the next slide, what's really helpful is this guide that we developed with our federal partners about how it can be done. And this guide talks about what is federal fund rating, and it's how two independent federal programs come together to fund one single federal project. And that little graphic you see on there is an example of a bus, and the person's a mobility manager using 80% of the Enhanced Mobility of Seniors program, and then using the other 20% Older Americans Act Supportive Services program. And everyone wants to know a real world example. So on the next slide, this is just how you can use the federal fund rating guide. It allows you to find detailed information in one place about which programs have statutory ability or prohibition or are silent on federal fund rating. We use the general counsel's office of each program. We worked across our general counsel's office to map when it's eligible and when it's not. So for example, the Department of Justice has 10 programs that can fund transportation, like the Youth Mentoring Program, the Family Drug Court Program, and they have statutory prohibition. So none of those programs can participate in federal fund rating, but the majority of the rest of the programs are silent, which means if there's explicit authority on the other end, like FTA's 3 programs, it is eligible, and explains all of that in detail. And then the next slide, here is where it's happening in the real world. So in New Hampshire, and I've linked to a really great podcast where the public health director in New Hampshire and transportation speak about this. So it's a wonderful, if you want to take some time to listen to that. But what they did is they took a CDC grant, it was a competitive grant, and they applied for that and got the funding, and they used that as match to their 5310, their Enhanced Mobility for Seniors grant for their rural, there's a 20% set aside for that program for rural communities. And they've hired mobility managers at 100% using the CDC funding for that 20% local match. If you go to the next slide. And here's a link. We have every other year, we bring our rural and targeted and state DOT grantees to DC. It just happened in August. And I've linked to 2 presentations that are probably of great interest to you all. We had the Health and Human Services Director of the Administration of Community Living, Laura Gearhart, come and speak. And she presented on the ability for their funds to be used as match to FTA's 5310 program. And I've linked to a couple best practices she shared in that presentation. And then the New Hampshire Director of Transport for New Hampshire, he spoke about that example I just shared with you. And I've linked to his presentation, which was excellent. It was really about how they got the partnership together, the exact cost of each mobility manager in each rural region of their state, and how it's being funded with 100% federal funds. And the next slide, some helpful information that people might not know about is that FTA put out some federal guidance on transportation coordination and the ability to report your transportation data into the National Transit Database. When you report miles, the more miles you report, the more money your community gets back. And this was to clarify how you can coordinate with other human services agencies like local senior centers, local centers for independent living, Meals on Wheels, etc., to increase your mileage reporting and be able to report it into the National Transit Database. So there's a link to that with more information. And on the next slide, there is also a very well-kept secret, unfortunately, about an exemption that applies to human service agencies. So the charter rule was passed in 2008, and it prohibits public transit grantees from unfairly competing with charter companies like taxis, charter buses, etc. But there is a set aside, an exemption that says if you receive money from any CCAM agency, so a list on Appendix A, so if you receive $1 of Older Americans Act funds, $1 of Head Start funds, you are exempt from the charter rule, and you can partner with public transit. And there are some photos of examples of trips that can be taken, like senior centers taking them out to see Christmas lights. All of those examples are exempt from the charter rule as long as the human service agency partner receives funding, even if it's $1, from another federal partner listed on Appendix A. So Older Americans Act is on there, Medicaid, etc. And then the next slide. And the reason we're sharing this is because we really want to make sure transportation coordination can occur in states like Arizona, and it's not being prohibited by the lack of this type of clarification guidance. And so this is another copy and paste directly from that guidance we put out in 2022 about how you can report trips. So as long as you have a coordinated human services transportation plan that calls out the partnership. So for example, if you're partnering with the local Meals on Wheels agency, and those trips from that is part of the coordinated plan can be reported to the National Transit Database. So that means you get more money back for your community because of that coordination occurring. The additional miles are then able to be reported to the National Transit Database. And there's more information both in the NTD manual and in that link of that guidance that we published in 2022. And then the next slide. And then this was very big during COVID. Incidental use has always been an FTA policy, but it only really got well understood and utilized because of COVID. And so what it is, incidental use is when any FTA grant recipient, so a public transit recipient, allows their assets, so a transit stop, a bus, a van, to be used by another entity like a human services agency for non-public transit purposes. So to take seniors to see the fall leaves. So the only requirement is it cannot limit or reduce public transit service that vehicle was intended for. So during COVID, we saw a lot of great partnerships for incidental use. Some examples were meal delivery, vehicle sharing to get nurses and doctors to services or clinics, etc. And then on the next slide, here is a resource. Anjali probably already shared this with you guys, but we have a wonderful database that pulls together, it's called the Transportation Technical Assistance Coordination Library, or TACL for those that love fishing. And it includes all of our FTA TA centers you see listed here that we fund. And you click on this TACL resource and you can Google best practices for senior transportation, bike share in rural communities, and up will pop all the resources in that topic area. And when you click on them, it'll redirect you to one of the technical assistance centers you see there. So it's a one-stop shop to search across multiple different websites of FTA-funded technical assistance centers, as well as FTA itself. And I'm sure this is my last slide, so coming up next. I wanted to make sure you guys know we have grant opportunities available through our technical assistance centers. So here are 3 examples of different types of, these are both planning and implementation grants. And the goal of these is to incentivize partnerships between public transit and other sectors, healthcare, aging, disability, workforce, you name it. And then the next slide is an open opportunity, currently open right now through November 17th for the National Center for Mobility Management. So these are pilot grants. So ready to launch, communities get if they apply and they're accepted, $75,000 plus one-on-one technical assistance to implement pilot projects that are multi-sector teams to pilot promising mobility solutions. And applications are due November 17th. And there will be other grant opportunities available through our centers, but this is the one that's open right now. And if you go forward, here are some examples of the breakdown of different grants that we funded through our technical assistance centers since 2015. As you can see, the majority have focused on specific health partnerships. And then the other is multiple, meaning it was maybe health and workforce, or it was youth and nutrition. And so the small purple sliver there focused specifically on older adults. And so these are the different types of grant programs that have been funded through our technical assistance centers with FTA dollars. And the next slide. FTA has a funding opportunity that's going to be out in the next couple of months. It's known as the Innovative Coordinated Access Mobility, or ICAM grant. This is an annual grant program, competitive. And so I just wanted to let you guys know there will be $9 million. A notice of funding opportunity will be made available. And this is about innovative capital projects, so mobility management, software, vehicles, et cetera, to help improve transportation for transportation disadvantaged populations. And it is encouraged to include non-emergency medical transportation. And so I just wanted you all to be aware that that's going to be coming out. And one example from 2022 was the Missouri Health Association received a grant for this project, this program. And I believe that's it. So I'll pass. One other thing. I saw that you guys were talking at this conference about how unhoused populations. So I just wanted to share this link. That conference I mentioned that FTA held, they had a panel that include the executive director of the U.S. Interagency Council on Homelessness, and then a Mississippi project where the Mississippi DOT is partnering with a local nonprofit. And I just thought it was a really great project that you all might be interested in. And there are links to this. And one of the biggest challenges they found is finding people at risk or that are experiencing homelessness, getting them trained to become public transit drivers to help fill in the driver shortage area, is that they didn't have an address to put on the CDL application. And so this nonprofit served as that address. They used their agency address, and it took away that barrier to getting more people secure employment. And there's a wonderful link at the bottom there to a woman, a mother of 5, I believe, who is now a driver for a local public transit, and it's just a wonderful employee, and it's a great story if you wanted to click on that. So with that, thank you all, and I will stick around for questions.
Thank you, Danielle. We do have a question from folks participating online. Can you please provide some examples or resources on Head Start collaboration to fund transit? Is this for 5311, 5310, or both, please?
So Head Start can't fund public transit, but Head Start funds buses to get Head Start folks, children to and from Head Start. Okay. And there was a wonderful ribbon cutting that just happened in Memphis, Tennessee, where the local public transit partnered with Head Start and just put a bus stop right in front of the local Head Start location. And our regional administrator for Region 4 attended, and it was a lovely example of that transportation coordination between the local public transit and Head Start to improve access for those low-income families and children.
Excellent. Thank you very much.
Sure.
Thank you, Danielle. And if anyone, and yes, I did mention Tackle, and National Arts App sent their Tackle books here. So we're very grateful to Kara Marcus and Robin Phillips for that. And they're all gone actually. So, so that's great. And the example she showed about Mississippi, I'm glad to see that they're in my region, and we've worked extensively on that project. So if you all have any more questions about that, please see me afterwards and I can let you know how that's going. It's been a really great resource and to fill that driver gap. The next person that we want to move on to is Ken Ellsworth, and I believe that he's also online, and he will talk about Verde Valley Caregivers Coalition.
Oh, thank you very much. And just a few words about Verde Valley Caregivers Coalition. We got started 31 years ago when a group of community leaders throughout the Verde Valley area got together and realized there is a problem. The people who can no longer drive can't get to medical appointments. They can't get to the grocery store. And most likely that scenario shows that their spouse has passed away and they have mobility issues. And so how do they get around? So they started a volunteer transportation service, Verde Valley Caregivers Coalition. And we've been providing services now, like I said, for 31 years. And we provide about 30,000 trips a year. And all of our drivers, our volunteers and staff drivers, drive about 650,000 miles a year. And we get people rides to about 8,000 medical appointments each year. On a given day, we have about 30 vehicles on the road. Volunteers on our own vehicles that we received either from donors or from ADOT. So it's turned into a big organization in a lot of ways as far as our outputs and outcomes. And basically that's a part of what we do to keep things rolling, is just building the capacity in all sorts of ways with so many different partners. And that's a work that's never ending. Always have to build it better. So that's what we do. Were there any questions or?
And are there any questions for Ken at this time? Okay, next.
Can you share what Verde Valley, the various communities that the Verde Valley covers, and and also what are some of the, maybe you said this, but I didn't hear you talk too much about some of the major challenges you're seeing in your area.
Yes. Well, of course, there are always major challenges. They never seem to end, do they? But the Verde Valley is a really interesting rural area. We have some small little communities. We have towns like Cottonwood, about 10,000 population, Sedona, about 9,000 population. We have living areas that are unincorporated, like Village of Oak Creek and Cornville. And then we have other small towns like Camp Verde and just lots of rural areas. Our total population in the Verde Valley is about 75,000. And it's spread out over about 814 square miles. And so the basic theory that we had way back then and that I've promoted since I started in 2010 is the fact we want to be a coalition of towns, of cities, of all of the resources here. We could not do this if Verde Valley caregivers wanted to just serve one of those towns. So we have about 160 to 180 volunteers in a given year. And they come from all places around the Verde Valley. And through our dispatch system, we can switch that around, you see. So we could have a volunteer who lives in Cottonwood come to Sedona to pick somebody up to take back to Cottonwood that has most of the healthcare facilities for our area, and just back and forth. And just lots of struggle with the rural area for the long distances. We have people who live in Camp Verde as a challenge, and it's about 25 miles from Cottonwood. And Cottonwood is the only place where they have dialysis. And so in a given year, we have 40 to 50 people we provide trips to who live in Camp Verde and need to get to Cottonwood. If they were to pay private pay out of pocket, that would cost them about $90 each day just to stay alive, out of pocket, to get their dialysis. We provide all of our trips free of charge. We don't charge anybody. But what we do, and it's really a major key to sustainability, is provide the opportunity for people to make a voluntary donation. And so we promote that nicely and through our care coordinators and our mobility managers. And we expect to raise not only from our riders, but also the donors here in our area, who really understand that they want to make sure this service is here for them when they need it, so that they can live out their lives in their place of choice. So altogether, we'll be bringing in approximately $1 million this year from individual donors. That has gone up considerably over the last 5 years or so, but we put a lot of effort into that and a lot of communications. But the people here love what we do. They know that's essential if they do want to stay here for their entire lifespan. And there are other challenges too, like healthcare in a rural area. It means that we've lost about 40% of our healthcare providers since the beginning of COVID. And so getting people out to, all of those other healthcare providers, especially down to the Maricopa County and even Pima County, et cetera, we provide those trips free of charge. But imagine that getting one person to one medical appointment may take 270 miles round trip just to do that. we provide about anywhere from 5 to 10 of those long distance trips every day. And that's a lot of miles, but it makes a huge difference. People can actually live out their entire lifespan in their community of choice. And I think having an age-friendly community to do that is really absolutely vital. And so we've met these challenges pretty well, but there's no backing off. We have to continue to move forward. Our major donor cultivation and our grant writing is really, really vital to our sustainability. We recently received a large grant from HRSA, the Health Services and Resources Administration, from HHS, to develop a network of partners in support of all of these services, not only in support of transportation, but also in making sure people with the greatest needs have a whole array of services that they have access to, not just medical care, but also all the social services that are available to support them as they age in place with complex health conditions. And so that's coming together. That's a large grant, about $1.2 million over 4 years. And we're getting a lot of enthusiasm about getting that group of programs together in one network and binding them together through a common software that we'll all use. And so we're looking forward to how that can help us move all of this and increase our capacity. That's what worries me the most is, will we have enough capacity for all the people who need our help? And I can tell you, just since July of this year to last week, we've signed up 115 new riders just in that period of time. So we take that and project that across a year, we'll be getting a little over 400 new people to serve in 1 year. Now that's a lot. That's a lot of new people to go out and visit in their homes and provide mobility management services to. And so we have that whole team, I can tell you, is just fabulous. We have a person on staff who leads that team, a care coordinator, and we have 12 retired nurses who go out to the homes. And a home visit for mobility management and care coordination takes at least 2 to 3 hours for the first visit, to be able to listen to them and understand those needs, and to be able to get to the point where we hear from them what really matters most in their lives. And I think it's important to keep in mind kind of the demographic that we're serving, who need our help at this point. And by and large, they're about 95% have major health conditions and very serious mobility issues. And their common desire is to live in their place of choice for the rest of their lives and to not be isolated. That's what they tell us. No, I know everything in my life has conspired against me to keep me locked up in my house. And the only friend I have is my little dog or cat and watching the news on TV. Well, forget about watching the news on TV 24/7, right? So it's getting out again through what we provide them, including social connections. We provide trips to fun places. We went up to the Lowell Observatory a few weeks ago with 30 of our folks, all requiring some standby assistance, and took them out to lunch and brought them back from Flagstaff to Sedona and all of our areas here. I mean, it's doing those extra things all comes from the fact that we spend that time with them in the home and learn what matters most to them. And that is the best, really, truly, it's the most amazing thing, reading all those thank you letters. Thank you for rescuing me. I'm once again back in the community. I once again can go to the library. I can go with a good friend, my volunteer, out to do grocery shopping. I don't have to sit there alone in the doctor's office waiting room. I have somebody to be there with me and to help me get back home again. I mean, it's just incredible when the community comes around and says, this is so important for all of us, let's do this. And now let's sustain it. Soon we'll be gathering together for our annual fundraising event coming up November 19th. We have about 200 people coming, and we can expect to raise at least $200,000 or more, and just at that one event. But what it does is actually promote Verde Valley Caregivers and actually anchors the meaning and the power of what we do in our communities. And so that really serves sustainability. You see, I had to take this as sustainability is local. It's kind of like politics. When they say all politics is local, sustainability has a lot of local features to it too. But of course, recently we've reached out to HRSA, and we'll need to reach out for some of these resources that Danielle has shown us, and be able to enhance that sustainability with those kinds of bigger resources out there. But if we can't do it locally, it may not happen. You see what I mean? That local is really important. The people love us, and that's where we focus so much time to be able to establish that sustainability and anchor it locally.
Thank
Thank
you.
you.
Thank you.
You're absolutely right. We're here. Oh, go ahead.
I'm so sorry. Quick question for you. Do you receive funding from NACOG? It's a question that we received online.
Oh, no.
Okay, thank you.
It's not available, as I know. I mean, I have not been informed about it. Many years ago we did, but not now.
Okay, excellent. Thank you. Anjali, back
And
to
the
you.
next person we have on the panel is Gabriel. We'll move on to him. And then after that, we will go.
Well, good afternoon, everybody. My name is Gabriel Jaramillo. I'm the Director of Healthy Communities with the Vitalist Health Foundation. Vitalist Health Foundation is a medium-sized foundation here in Arizona. We work around the social determinants of health. Many of you might recognize Vitalist for the Vitalist wheel that incorporates the elements of health and community. And we play a unique role in seeing how we can use our grants and funding available to help integrate health in a variety of aspects, but really at the intersection of those social determinants of health. I focus a lot of my work on the built environment, specifically in transportation and housing, and we work statewide. Well, I have the benefit of working with organizations like Kent's and other members that are working on the integration of health and addressing health in a variety of aspects. Most people, when they think of health, they think of the physical health, the doctor's offices and clinics and things like that. But when we really look at it, it's so much more than that. It is access to walkability, food, transportation, and everything that connects those. So we've seen a huge weight, huge burden on cost burden households recently with the increased rental rates and mortgage rates. And for those individuals trying to stay in place, age in place, that's become more difficult. Populations that are on fixed income, that's become very difficult. And we've seen a huge surge in homelessness from the senior population, which is a big issue. And Vitalist works with not only community-based organizations, government entities, state agencies to see how we could help address these issues more efficiently and try to work on multiple facets as opposed to working in silos, which we've seen in the past and haven't worked. So again, Vitalist plays a unique role, and we work with a variety of organizations and hear unique solutions, and we see how we can help support those organizations to try to solve this issue or best provide a best possible solution.
Okay, thank you, Gabriel. We are going to start with questions. And are there any questions in the chat right now, Amy? Okay. And I'll get yours. I won't forget. The first question we want to talk about is, what funding sources have you all found to be the most sustainable for you currently? And what opportunities could be further cultivated? And we can start with you, Gabriel, and then we'll go to the screen.
This is a little bit of an interesting question because as an organization, as a foundation, we're the funder. Again, we're a relatively small funder, so we use our resources to try to partner with organizations to try to make those changes in the community. But as far as sustainability, one of the biggest things that we've seen is policy change, and that's where Vitalist focuses on, see how we can affect policy on a broader scale. So I was actually just recently at another federally qualified health clinic webinar, and we spoke about the ability of peer-to-peer and how that could help bridge a lot of gaps, especially in our urban and rural communities. But the sustainability aspect came around, and now that community health workers or community health representatives have become a more viable option due to the reimbursement aspect of it. With some training, you can have that peer-to-peer opportunity to help bridge some of that gap for our urban and rural, rural and remote communities. So we've seen organizations reach out to see how they could take advantage of that, but there's navigating of the reimbursable services aspect. So to us, the more sustainable products are the more sustainable funding mechanisms are going to be through policy changes and adapting local policy changes. I think another one of those aspects is here in the urban areas, we can talk about transit-oriented development and better connecting communities through multimodal transportation and accessibility to transit. But in our rural communities, we really had more communication about co-locating services. So we're working with rural communities on how to create housing, senior housing, with a federally qualified health clinic already in place at the bottom floor with some childcare services or some job training in it. So again, that's a policy change that could be adapted in our rural and urban, rural and remote communities to help address some of the transportation aspects. But that would be, again, from the perspective of foundation, those are the things that we found most sustainable.
Okay, Kent.
Yes. Well, the most reliable source for sustainability really is relationships, right? So, developing those relationships locally, that's what's really helped us get to where we are and to help us grow a lot. So being able to develop the capacity as it is needed by the people we are serving is really key. And it's just the not only the local cities giving us funding, but all the churches and individual donors. What is missing is funding from the county government level. And so we don't have that here. And we don't have funding coming directly from the state legislators to the 5310 program. In my view, I can share that, I'm sure. I always believe that local funding from local governments should provide at least $10 for every $1 of the federal dollars coming into the state. I mean, that's the kind of partnership we need from counties and the state government to pair up with the FTA funding coming to our state. And but we're not there yet. I do know of some places that are there that are working on that, even rural areas, such as the area of Western Montana. And I worked there for quite a few years. And the people in the county came forward and they're providing at least $10, maybe $15 for every $1 that comes in for their area agency on aging. So that kind of partnership is what we have to head for. Thank you.
Do you have any examples you'd like to share?
Yes, well, I think if you look at the Area Agency on Aging in Missoula, Montana, well, it's a 2-county area agency on aging. They've done really great work to promote not only transportation, but that whole array of services they provide and to get local funding. So, I mean, if they had to rely just on the pass-through from the Administration on Aging, they would only have maybe 10% of the program that they have now. But they were able to promote it locally and to be able to get the county, the population, to vote on tax increments to support directly aging services. So that's a good example. And I think we don't have that here in the state yet, but I really believe that would really help us. Like I said, we know that sustainability has to be a result of relationships. And relationships have got to be local too. And so we've got to make that work.
Thank you, Kent. Danielle, do you have any examples that you've seen other places?
I would just mention the reason Congress put that ability to use other federal non-DOT funds as matched to ours is because a lot of rural communities were having their funds lapse because they couldn't come up with that local match. So sometimes there are policy flexibilities to help communities succeed. And one sustainable funding source, if you're already getting Older Americans Act, supportive services, Title III-B services, and you're also getting 5310, those funds can be matched. And we linked to Lori Gearhart's presentation about how that can be done in the Administration for Community Living's words. So I guess what I would just say is there are opportunities for transportation coordination to sustain two sources of federal funding coming together as one.
And we have a question here in the room. Is that Jimmy? Am I saying it right?
Jana, and I'll be quick because I know we need to transition, but my question was specific to Gabriel, knowing the history of Vitalist in systems and policy work. I just wonder what you see as the future in transportation as it relates to that. Will Vitalist, for instance, use its convening power in the future to really begin to even continue conversations like this? Not to put you on the spot, but I just love what you all do, and really grateful to hear that you're working in the transportation space, because I did not know that.
Thank you, Jenna. Yes, we will continue. I mean, Vitalist always has our door open for any community partner addressing the social determinants of health. In the past, Vitalist had focused a little bit more on transportation. When I arrived just over 2 years ago, really housing was the biggest aspect of it. But when I talked to my boss, Suzanne, we really talk about the built environment, and that includes transit-oriented development, which includes transportation, and that extends to our rural and remote areas as well. For the longest time, we were one of the main the sole funder for the Coalition of Transportation Choices. So we've still participated, not at the same levels, but we're still continuing the conversations on transportation and are open to obviously any application through our grant funding and to help support and any advocacy. We were a big supporter of Prop 400. We were active in that aspect as well to make sure that there's still mobility funding for that, and we will continue to champion that through policy as well. So short answer is, yeah, we'll still continue.
Are there any questions in the chat? No? Okay. We'll go on to the next question. With the changing landscape in Arizona, the transportation need, healthcare needs, the economy, what steps do you all think that you can take to help coordinate, integrate, and collectively address the needs in a more sustainable way? We'll start with you, Gabriel.
I'll go ahead and start. I guess in short answer is really looking at maximizing resources that not only governments but communities have locally. We talk a lot about zoning, so maximizing the transit-oriented development, the walkability. We worked recently with the city of Surprise as they brought they're going to be creating a multi-generational center. And when we had the conversation, when they reached out to us about social determinants of health and what else that they could do, they have a piece of land that they're developing with a concentrated services. How do you bring housing? And they're going to be doing senior housing around the services that they're going to be providing to the broader community, not only to help those individuals that are going to be within walking proximity of that, but to maximize the use of that property that the city owns, that are addressing a variety of needs for that community. So for us, really, a lot of it has to do with how to maximize the use of assets, and that includes land, that includes funding, and how to braid those and co-locate and maximize those aspects. So we're really focusing a lot on that systems approach.
Ken?
Yes, thanks. Well, in a rural area, the Verde Valley area, we have so many little towns and unincorporated rural areas. I really see that we'd be much better off if we kind of loosened those barriers between the different towns and coordinated all of this together as one area, the Verde Valley area of Sedona, and all the communities working together to create a common plan and to find funding for that common plan to create interconnected communities. So, it just, in a rural area too, not one community can provide everything. So we have people who want to go shopping from Sedona to Cottonwood because they don't like the grocery store in Sedona. And that may cost about 20% more. So you see what I mean? It just, there's a lot of reason for us to kind of drop our community barriers and become one area, be able to see each other, plan together, fundraise together, develop together. So community development isn't isolated to one community. It should be the whole thing. And I think we'll make lots of progress when we can grow to that level.
Okay, thank you. Danielle?
I just want to echo what Kent mentioned earlier about those partnerships. The thing that struck me most about the New Hampshire presentation about that federal fund rating example is how it was that the public health and the DOT had invited each other to their planning exercise meetings. So they were already they had a partnership established. So when COVID hit and this great funding opportunity came out from CDC, the public health director already knew that transportation needs in rural communities, especially for older adults. So they built in that transportation piece into that competitive grant application, which made them more successful, but also harnessed more money for the state that they were then able to leverage as match. So it was just, the whole point is to echo what Kent said, is that those relationships are so key to bringing more money to your community.
I want to also mention, and I'm glad Danielle it just popped in my head when she was talking about the healthcare workers earlier. So we were at the NCMM forum earlier this year, and we've been working, NCMM has a food access mobility group, and across the center is an ADTC, NCMM, even National RTAP, look at social determinants of health and transportation. But I think it's important to know, especially out in this area, I've heard in conversations yesterday, people talk about they have nurses going out doing the mobility management visits and what the needs are, or community health workers or social workers. And through HHS, we found out that they have their community health workers, which are essentially somewhat mobility managers. And then on the transportation side, there are mobility managers and transportation coordinators. And then also through the veterans side, with VA, they have VTS workers, which are mobility managers. And so everyone is doing the same thing across the CCAM agencies, but developing those partnerships and tying the funds and the programs together to maximize, and that's even at a local level with the VA centers and clinics and things, can really, really help mobility options and help sustain programs. So I just want to throw that out there. And that's something that we've looked at, but something that I'm trying to develop those people that may not always be at the table, inviting those parties here to the table at a local level and a regional level as well. So I think that's really, really important. The last question is, as we talk about those partnerships, what has helped you develop a sustainable partnerships to continue working to positively impact your local community, individuals, and just the economy as a whole? How are some of those ways that you've gone about? Because we also heard that a lot of invited to the table, but they haven't came. And I kind of, my policy is keep inviting to the table, inviting to the table. And we were talking about this morning.
Anjali, sorry, the folks online can't hear you very well. Can you please get closer?
Can you hear me now?
Oh, yeah.
Okay.
That's good.
So
Thank you.
I'll repeat the question is, what has helped you to develop sustainable partnerships, continue working together positively impact your local community, individuals in the economy? And we've heard that people say, well, we've invited people to the table. We keep inviting them. They haven't came yet. And my policy is keep inviting them. They'll always come. We learned here this morning that, Arizona DOT was here and they were like super excited. And now they want to come to the table to really, really be involved. And that's a great thing. I think that's been a long time coming in the Valley area. So what are some of the things that you all have done to get people to come to your table? Or as I think it was Amy that mentioned that, we can crash the party and go to their table. And I'm all for that as well. Like I'll bring my own chair to your table and we can make things happen. So, either way, we'll start with Gabriel.
We'll definitely take Amy's approach, and so yeah, Vitalist, we don't have a table. We have the resources, and we understand the position that we're in and how impactful that could be. So we were working with the Social Vulnerability Index, and we mapped the entire state to show the biggest needs throughout the state. And that's where we're going to be targeting our resources. So we're going to go to the communities and make sure that we have an effort in those communities and build and develop partnerships within those communities to identify their needs and promote our resources where we can help partner with them. So same thing like Amy, we don't have a table. We're going to go see how we can join other people's tables and hear from them. So that's another big one, and just continue to collaborate and work with different organizations, make sure we review our applications at that position that we have to make sure that we're hearing what the community concerns are and seeing how we can partner with various agencies. Or the other thing that Vitalis is known for is influence and policy. I have the ability to participate on the governor's interagency council, to understand that there's interconnectedness with various agencies that have a variety of similar objectives and programs, and how those could best be utilized and more efficiently distributed through communities. We have that ability. So we try to invite organizations or community-based organizations to the table where we can, and then show up to other people's tables when we have the opportunity.
Okay, Kent.
Yes. So we do a bit of both, the table crashing and having our own table. But part of what really matters is the fact that we have about 1,800 to 2,000 people we serve each year. And guess what? We do know what matters most to them. So that's the message we carry to that other table out there. And even an elected official, honestly, if we say, we know what the people voting for you really want, we know something about their lived lives and what would really help them. So bringing the message of all the people we serve out to these different tables really has made a difference. And it's really made a difference even in the place where we have our office here in Sedona, Arizona. For quite a long number of years, Sedona did not fund us, did not give us any funding. But now we're a part of their selected funded group every year. So we get 3-year grants and re-up for another 3-year grant, et cetera. And that has gone up steadily each time. But that's because we go out there and know them. We have them come to our board meetings. We go to their council meetings, and it's that relationship again. But now we have to do that for all kinds of organizations around the Verde Valley, including the Rotary clubs and the churches and every place, keeping an open mind that when we're there presenting and we're there connecting, that we might get something out of this, that there might be someone in that group who will volunteer. Here's this little story. I got invited to do a presentation at a club, and believe it or not, it's kind of old fashioned, really. It's a men's club, and it's called the Bola Club. So we have to wear Bola ties when we go there for lunch once a month. But what happened after that presentation? I got 3 wonderful new board members, and one of whom was then the president of our board for several years. And in his regular career, he was appointed to be head of the World Committee to get rid of SARS back in 2003. And he had his own global consulting company to deal with pandemics way back then. So he became a part of our board just in time for COVID. And we could design our systems and our programs around his expertise. I found him at one of those meetings. I got 6 new donors at that one meeting. And combined, I can tell you they give us about 180,000 a year just between those 6 new donors. And so it's like getting out there is everything. It really does make a difference with carrying the message of the people we're serving, because they're not going to hear that message anywhere else. They're probably not even going to see the people we serve out there at the movie theater or at the restaurant they go to. A lot of the people we serve are kind of hidden from the general public view. So seeing myself as their spokesperson has really helped me better engage with all these folks out here. And so that seems to be working. Thank you.
Yeah, and you may not be able to speak on a local level, but even just at a regional or a state level, talking about how, one can develop sustainable partnerships that positively impact, at a regional level, and it trickles down to the local agencies that receive the funding.
Yes.
With that to me,
Yes.
okay, I just want to echo what the other said. It's really important the partnerships. I work federal to federal agency level. And I think it's tough because with the coordinated council, there are 11 departments, 29 sub-agencies, and really understanding each one's mission and and speaking in their language. And it's just about developing those partnerships. I mean, you talked about Head Start earlier. That's just one of 130 programs. So you can't be an expert in all of them, but you can ask questions. And I think the story piece is what the other two presenters were getting at, that person-centered, why this matters, and just be a good partner, as well as don't do too much asking, show up at their tables and be a partner. I found has been very helpful to keep the federal engagement with our other partners.
Hey, thank you. Do we have any other questions in the room? I want just to pause. And do we have any in the chat? Okay, great. I wanted to touch on one last thing here as far as sustainable policies and plans. And Gabrielle, I'll start with you in the Valley. I know there was some questions about that a little bit yesterday, as far as we live in a very sustainable, focused kind of environment in Arizona, and that's been for a long time. But what is, kind of the best way to help integrate sustainability into the plans locally and around the state, and how have you seen that change a little bit to be more of a focus?
It's a little bit of a tough one. When you think of sustainability for transportation programs, you think of funding. So things like Prop 400, and unfortunately, the change for that has been a little more hostile. We saw that through the past legislature with some of the recommendations, and how Prop 400 evolved to what eventually was passed and what's going to be going to the voters. But
Can you talk a little bit about Prop 400 in case someone's not aware fully what it?
Sure. Prop 400 is the state's passing of legislation to allow Maricopa County to issue a tax increase for the light rail and transportation on a, I don't know all the ins and outs and the details of it, but it's for transportation that includes light rail. It actually had, what's that? Highways and the highways and some of the repair. So a lot of the funding or a lot of the initiatives were taken out of the original bill, which has left the cities the bill for some of the funding that Prop 400 had previously covered. It was an extension of a tax, so it was a continuation of one. It's not a new one. So things like that. So how do we work with legislators to make sure that we show the importance of something like Prop 400 when it comes to sustainability and the funding that it provides, not only for transit-oriented development, light rail, multimodal transportation, but also freeways, highways, and the repairs and the maintenance of those. So unfortunately, I think we've got to be a little more active in working with our legislators to show that importance. I think I'll leave it at that.
Okay, we do have to wrap up a little bit. We just had a couple minutes and we've gone over time. Kent, did you want to touch on any policy in your area that you've seen? And then we'll wrap it up from there.
Yeah, we don't really have, like I said, a policy coalition here to handle our rural area. Each city entity has their own set of policies without actually coordinating that to create an overarching policy pathway to sustainability or even growth as an area. So we still lack that. So I would like to see that happen sometime.
Okay, are there any other last remarks from Gabrielle, Kent, or Danielle? Okay, Thank you all for being on the panel today. If there's any questions, then Amy and Kelly will make sure to send out their information to reach out to them. Or as we stated before, we give you the information for all the TA centers and information that she has presented. And if there's any questions also about, she had mentioned the pilot grant coming up, which I've talked to many of you all about. You don't want to miss those deadlines. So please come and see us afterwards. We'll transition over to Kelly.
Yes. Thank you for that excellent panel. It was wonderful to hear from so many across the state. So once again, we are coming to a close for today. Thank you again for attending. For those who were here yesterday, thank you also for being here 2 days in a row. We really appreciate it. I hope you are as excited as I am about how this conversation continues after today and the next steps we can all take. I know one of the commitments that we're going to make at MAG is to make sure that the conversation does continue. So we will be following up with you with a survey. If you could please take the survey, we would really appreciate it to try to figure out how we can better serve your needs and how you thought the last 2 days went. We will also be following up with you by email with additional information and resources that were shared from today. If you're interested in any of the slide decks that were shown over the last 2 days, they've been posted to the Age Friendly Arizona website, which is where you registered for the event. But we will be sending a follow-up email to everybody who registered for today and yesterday, and providing those links as well, so you don't have to remember any of that right off the top of your head. We do have an Amazon gift card that we're going to select from someone who completes the surveys. If you need a little extra motivation to give us that extra 5 minutes of your time, we would really appreciate it. And from the MAG staff, I want to thank all our partners at NADTC who traveled to be here with us and made this an opportunity for our community. It's just exciting for those of you who are student council government nerds like me to see your tax dollars going into something like this. I think it's so exciting to be able to watch public and private programs come together to talk about how we can make our community stronger, healthier places to be for everyone. And I appreciate your participation in that. So thank you again. And we look forward to seeing you in the future. Are there any final questions or anything that we can help you all with?
Oh, I saw that people were taking pictures of the slideshows. Those are going to be available for you all. So in case you missed anything and people are trying to take notes. So I meant to say that earlier, but I saw people trying to do with their cameras.
Yes, Catherine.
Just wanted to remind everybody, NADTC is here for technical assistance, resources. If you are not familiar with our website and what we do, please, there are some flyers in the back that show all of our contact information. We have a number that you can call for technical assistance. There are just a number of resources on our website. We have a e-newsletter that goes out monthly, e-alerts. We do a lot of, share a lot of information about transportation resources, programs, grant opportunities, and all of the good stuff. So just wanted to remind everybody about that.
Go ahead, Dee Dee.
Hello, everybody. If you are interested in our Transportation Ambassador Program and would like to be on our mail list, please share your business card with Ezekias. We have a monthly newsletter that goes out. We also have 4 quarterly meetings that you will be invited to. We also have workshops and trainings on driver safety, how to deal with special needs passengers for drivers, preventive maintenance. So definitely we would like to add you to our mail list. So thank you.
All right. And with that, I formally conclude our 2-day conversation and appreciate you all again. Thank you so much.